Good morning from UCLA, a land-grant institution where I will first acknowledge the Tongva peoples as the traditional land caretakers of Stavanger, that is the Los Angeles Basin and South Channel Islands. I'm Ninez Ponce, director of the UCLA Center for Health Policy Research and professor of health policy and management at the UCLA Fielding School of Public Health. Welcome. Welcome policymakers, students, researchers, alumni, community members, colleagues, faculty, and friends. It is a privilege to have you join us at this year's important and timely symposium, Opening Doors for All, Improving Health in Housing and Homelessness. This symposium series is named for E. Richard Brown, founder of the center in 1994 and professor at the UCLA Fielding School of Public Health. Rick was an extraordinary leader, scholar, mentor, and friend. He passed away in 2012 to our enduring sadness. Yet his work and impact not only still heavily influences California today, but extends nationally as well. Amidst a year and a half of many losses, we also lost another public health giant here at the center with the passing of Steve Wallace in March of this year. Rick Brown and Steve Wallace continue to inspire and motivate us to engage in impactful work. They believed in building a strong data and evidence base about the public's health in the service of stimulating and catalyzing well-crafted policy proposals and action by policymakers, funders, and others. Rick's vision lives on in the center, which is best known for providing comprehensive data on the health of Californians through the California Health Interview Survey, which many of us fondly know as the CHIS. The CHIS is the nation's largest state health survey and a valued resource for leaders everywhere, often cited by policymakers, patient advocates, and health system reports as evidence for policy and program decisions. We are also known for developing innovative tools highly valued by policymakers. Two examples are the Elder Index, thank you, Steve Wallace, used to understand the unique economic issues facing older adults and the implications for their health and healthcare access. And CalSim, a microsimulation model used to estimate the impact of various elements of the Affordable Care Act. And that's led by former center director, my colleague, Dr. Jerry Kaminsky. So these tools join our award-winning query systems designed to realize the center's philosophy that data doesn't just sit on a shelf. Rather, it should be made accessible, easy to understand, and it should be used by everyone. So I am honored and proud to work with such a talented team of more than 90 individuals that make up the Center for Health Policy Research family. Our values demonstrate a commitment to producing high quality, actionable data and evidence that drives change with the goal to improve health for everyone in our communities. We started the symposium series in 2019 with the generous support of Rick's wife, Marianne, who I think is out there in our Zoom community today. Good morning, Marianne. That first year, we held 2 days of panels and discussions in both Sacramento and at UCLA about the potential for a healthcare for all model to be implemented in California. And the event brought together international experts in universal health coverage systems, state policymakers and healthcare leaders, community representatives, advocates, and researchers. And last year, we moved the event online. We discussed a long-standing issue that was laid bare by COVID-19, the impacts of our fractured system of healthcare derived from racism, inequality, barriers to quality care, and in some cases, the underinvestment of public health. So we discussed how to address these challenges and how to begin healing. While COVID continues to spread and impacts both our health system and our broader community and economy, It exposes yet more societal issues drastically impacting health, and that's housing and homelessness. The lack of affordable housing in California and large number of people without permanent housing are not new issues, but the pandemic's impact on jobs and income further exacerbated how many of our neighbors are in precarious situations, one lost paycheck or one unexpected bill from losing their homes. Housing and health are inextricably linked, from the stress of potentially losing housing to the significant toll that homelessness takes on a person's physical and mental health. The issue dominates the media, and policymakers are making strides to address the issue at local and state levels. Governor Newsom has announced that major funding will be invested in a more comprehensive strategy to attempt to address the issue on many fronts: programs to stop more individuals from falling into homelessness, programs to create more affordable housing, and programs to address not only housing, but health and social services to help keep people housed and healthy. Certainly, there are many different ideas and strategies being offered by policymakers and program directors and community advocates. And there are several questions policymakers will grapple with in the coming months. What are the best investments to make to truly address the problem? And do those programs equally help all homeless segments, especially high-risk groups and communities made vulnerable by systemic racism and inequality? How do we enact effective policy and invest resources that we can scale up, so on a large scale, while honoring the humanity and unique circumstances and needs, phasing the unhoused of all ages, from Bakersfield to Berkeley and Oxnard to Oakland? I hope our symposium today and tomorrow will get us all thinking and coming together and embracing evidence-based policy solutions to these hard questions. Over the next 2 days, we have leading voices from across the country who will share their lived experiences, frontline insights from past programs, considerations for improving equity in programs, and recommendations for truly helping our unhoused neighbors. We will also have some policymakers to share some of the current discussions happening in Sacramento and in cities around our state. So with that, thank you. Thank you to our featured speakers, our moderators, our panelists, our sponsors, the Fielding School of Public Health, and the staff for putting today's symposium together. I especially want to thank the work of the Planning Committee, and you will see them interspersed because they got voluntold to also do some of the moderation and reflections, and I'll introduce them when they come on the screen. I also thank each of you for being here today and look forward to a productive and vibrant discussion. So thank you very much. We're going to start with our first keynote speaker. So it might be a surprise that the UCLA Center for Health Policy Research is hosting a symposium that's dedicated to housing. And in our research, we have understood that addressing housing needs is a critical component of achieving health for all. And our first speaker today really understands that. In his role as the former mayor of Nashville, Tennessee, Bill Purcell experienced firsthand the need to tie housing to health, and will share with us today the importance of integrating both into a comprehensive plan. We welcome the Honorable Bill Purcell. Bill? The Honorable Bill Purcell. Bill?
Thank you. It's a great honor, frankly, and a privilege to be a part of this 2021 E.R. Brown Symposium. And I want to thank Dr. Ponce for her leadership and for teeing up today's and tomorrow's conversations. And I join her in thanking as well the planning committee, which was so engaged throughout, frankly, this summer and through all the days that led to us being together now. And I join as well in thanks to the Brown family for their continuing support and encouragement of this work. It is a special privilege to be the warm-up act for Mayor Libby Schaaf, who has worked, frankly, in such a focused way and worked so hard to address the issues of housing and homelessness and all the related issues in Oakland and now in California as a part of Governor Newsom's Council of Regional Homeless Advisors. There are a number of voices that we will hear, but clearly Mayor Schaaf is there on the front lines in the state of California and is an inspiration to us all. You should know that, and I think that everyone, especially those in California, particularly those at UCLA, know that the United States and the world look to California as a place where public policy issues and solutions often first surface. And on the issue of housing and homelessness, I should share with you that there is an early connection between Los Angeles and Nashville, where I am today. And I'll spend a moment on history here at the start of our 2 days together, because I believe from experience that to know where and how to get where you're going, you need to know where you are. Frankly, to understand fully where you are, you have to at least have some understanding of how you got there. So let me start back a little further in history to begin our day together. Charles Fuller was born in the orange groves of Los Angeles in 1887. He left his family's citrus packing business to become, was called to be a Baptist minister and ultimately known as a radio evangelist. In my favorite year, the year of 1953, and it is my favorite year because it's the year I was born, and so I'm fond of that year. Interestingly, in that same year, Charles Fuller came to Nashville. He was here for a revival at the Ryman Auditorium. You may know the Ryman Auditorium. For most of its history, it has hosted the Grand Ole Opry, the longest continuously operating radio program in the world, in the history of the world. It is the mother church of country music. It's also the place where a little more than 75 years ago, Bill Monroe first announced a new musical genre, bluegrass music, known in that fashion for the first time at the Ryman Auditorium in 1945. 8 years later, Fuller is here in Nashville, staying in a hotel in the center of the city, not that far from the Ryman Auditorium. And as he went to the auditorium on each occasion during his stay in revival here, he noticed homelessness on the streets of Nashville. It was so compelling to him what he had seen that he talked about it during his sermons, his speeches, his talks as part of this revival here. At the end of his stay, he'd been so moved by the need in Nashville that he returned publicly his honorarium and asked that it be used to create a facility for the care of, and this was the description he used, the homeless and the hurting. Fuller returned to California, and a year later, our first homeless shelter was opened here in Nashville. It became known as the Nashville Rescue Mission. And I am actually not sure in this long history whether anyone has ever thanked Los Angeles for this, but I at least should do that now and tell you that my purpose today is to share my insights from the other side of the country, not to prescribe solutions for you, but to understand, frankly, how consensus about the need and the solutions is possible, and my experience in doing just that. For much of the last century, certainly after Fuller's time here, we looked first to the private sector and then we looked away. Then we began to look to the federal government for resources and solutions in housing. In my time in the legislature, I spent 10 years there from 1986 to 1996 in Tennessee. As the federal government's commitments stopped growing in the area of housing, the whole wide range of housing supports and resources, It fell increasingly to state governments, some more and some less, quite frankly. But by the beginning of this century, it was increasingly clear that local governments were on the front lines of homeland security and education and quality of life and housing and employment, and all that quality of life requires was right there, right in front of our mayors, our city governments, our people at the local level. Let me acknowledge that at the start of this century, now 21 years ago, housing had not been on Nashville's agenda because, again, it was somewhere else. It was interesting here, the way in which consensus began to develop. It actually started in our service clubs, and the leadership in particular of our Rotary Club, then bringing our business community together in Nashville that laid the groundwork for an understanding about the needs here broadly for housing, and did the hard work of an assessment, actually counting. What do we have? What do we need? What's missing? And it was that early accounting of housing needs here that said to a new mayor, me, that affordable housing was a critical need in the city. And in fact, the whole wide range of housing programs needed to be addressed, and we needed opportunities across the board, and our future was dependent on it. They put a number to it. They said we need 35,000 units by 2010. At that time, Mayor Tom Menino in Boston was doing something very similar, in fact, ahead of us and many others. Mayors in California, your governor now, also were focused on this increasingly clear need at the local level. And everywhere, frankly, in between, where cities were reflecting on their futures and focusing on their presence, they knew they had a need for housing. We also began to understand the relationships between housing and homelessness and hunger. The U.S. Conference of Mayors established its task force on hunger and homelessness, and year after year after year, to this day, the mayors together on a bipartisan basis come forward and again remind America of the increasing needs on the streets of our cities, both large and small, in particular the needs of our homeless populations and the hunger that surrounds not just homelessness, but so much of our populations. And year after year, that count and that report and that focus is brought to the underlying issues that we discussed today. That also resulted in a new federal focus at the beginning of this century. Phil Mangano is going to be joining us in the next panel, and he was a part of that very special effort to increase national awareness and national consensus around the problems of hunger and homelessness, in particular, homelessness in the cities of America. In Nashville, we began partnering with the public sector and our nonprofits and our for-profits, and we created 26,000 affordable housing opportunities, a number that I know, particularly for Mayor Schaaf and others, is not a huge number, but for our city was the number we needed to move us forward to the goals that we had set. And frankly, increasingly at that time in our history, the issue was understood to be moving in the right direction. 45% of those units were home ownership, 35% were rental, 20% rehab and preservation, a critical part, I think, in most cities of the calculation that we need to make as we think about what we need to do. And here, as in much of the country, the Great Recession changed our priorities and our focus. And when we looked up a decade later, there was a new need recognized for affordability and a new need, especially to address the issues of homelessness that had again moved to the front of our agendas and our civic life. Our last point in time count was in 2020. We began doing that count in 1987. Most every city in America leads now the point in time count regarding homelessness. We found at that time a year ago, there were 2,000 homeless counted in our city, but frankly, some estimates, credible estimates, would say for our city, the number is 10 times that number. And in materials for this symposium, obviously California's numbers, because of your size, because of your location, are extraordinary as well. This pandemic has indeed, and we acknowledge that, I think, all of us, created another unexpected existential crisis to join others. But it has also brought a renewed federal leadership and financial resources. an opportunity for the kinds of partnerships, I believe, that are needed to meet the challenge, the kinds of partnerships that have been successful in smaller scale in the past, and the only kinds, I think, of success that will be possible for us to not just meet this challenge, but also to prevail. In National Care's funding was placed in the hands of dozens of nonprofits, and that provided in this year rapid rehousing of 500 families. It is for us the fastest, largest dent that we have made, the most significant, I think, change in our response in this century and probably ever. There is a great hope here now, as I think and believe there is on everyone attending this symposium, that we will have additional resources. There was a critically important release by the Biden administration just about 10 days ago now, outlining their hopes for what might be done again as part of a federal recommitment and further commitment across the board, with a focus not simply on affordable housing, but on homelessness as well. What is absolutely clear is that the success and well-being of our cities requires us to address and sustain our efforts in the area of housing broadly, affordable housing specifically, and homelessness as well. Cities in California and in Tennessee cannot address this issue alone. These front lines are in the streets of our cities and in front of us each and every day and night. But there is no question that cities being alone are not in a position to meet all of the needs of all of our people. It's going to continue to require partnerships in policy and partnerships in resources, federal resources, state resources, local resources, and as Nashville's experience, and I believe California's experience as well in recent times, it's also a partnership with the private sector, our nonprofit sector, our philanthropic sector, and our for-profit sector that need to sustain and nurture and create, frankly, new relationships that will be maintained for the long term. This is an issue we know from experience here, and I think in other cities. It is not just a challenge, it's not just a crisis, it's not just an opportunity, but it is for the long term, for the long haul, an obligation of cities if they are to be successful and if their people are to be sustained. About this, there is no question. It is from now on, it's forever. You look away on a critical issue like housing, and the world changes and heads back. The connections that Dr. Ponce made so clear at the top, I think will be reiterated throughout the 2 days here. The connections between health and housing, the connections between the social programs and the social sustenance that needs to be provided and can be provided. I think that a number of speakers will say quite straightforwardly, we know the programs that work, and we know the programs that add value, and we know the things that people need who are confronted with homelessness and who are looking for housing now. The challenge is for us to bring all of the resources that are needed together with the people who must be together in this work in order to not only advance the cause now, but sustain it over the long term. We know the effect of health in our cities. We see it in individuals, and we understand it both morally and also economically. Each of our cities wants to be a healthy place. Each of our cities needs to be a healthy place. In Nashville, we have a significant healthcare portion to our economy that includes both for-profit and not-for-profits. Nashville is a place of great hospitals and great healthcare. It is a place that is known, certainly we believe in our region and in the world, as a very good place to receive medical treatment, a very good place if you were going to have a heart attack, to have a heart attack, a very good place to receive treatment for diabetes or cancer. Everything from heart transplants to the most modern medical technology available is here. But what Nashville wants to be, and every other city wants to be, is the best place not to have a heart attack, not to have cancer, not to have a health issue, not to be challenged by the basic needs of health and healthcare. And the effect that health has not simply on individuals and families, which is obviously front of mind for all of us, but also on the economic well-being of the place. And it's not simply in the costs that come to our health insurance premiums or our federal and state programs to sustain health, or even our local public health departments, whether they're county or city-based. It is the cost in addition to the overall success of the place, the effect that poor health has on absenteeism, the effect that health can have on presenteeism, the cost to the productivity of the place, combined obviously with the desire to be a place that people want to come to because it is a healthy place, that people want to stay in because it is a healthy place, a place where their health is not only, and their problems are not only cured, but their health is protected and preserved. So having said all that and realizing that Mayor Schaaf is here, I'll leave you with a little more history. And since Reverend Fuller started my story, perhaps at least he would approve, one more historical reference. It's about 2,700 years ago. And it's the prophet Isaiah who prophesied that those from among you shall build the old waste places. You shall rise up the foundations of many generations, and you shall be called the repairer of the breach, the restorer of streets to dwell in. That, it seems to me, is a prophecy worth pursuing. And I hope and believe will be part of the work that we have together over the next 2 days. Thank you very much.
Thank you very much, Bill. Thank you very much for setting the stage for us. And again, and thank you for your farsightedness, your foresight when you were mayor in making these investments. I am so excited to have our special guest join us today, and fittingly after Bill Purcell. Joining us this morning is Oakland Mayor Libby Schaaf. During her time in office, Mayor Schaaf has created a system of effective strategies that address homelessness at every step of the cycle. We are so excited to hear more about this critical work, and it is my pleasure to welcome Mayor Libby Schaaf. We are putting more of the bios on the chat, so please have a look at that and welcome Mayor Schaaf.
Thank you so much. It is truly an honor to be invited to speak at this symposium. And I come with all humility, because as a mayor who took office in Oakland, California in the year 2015, I didn't know anything about homelessness and very little about health. For those of you who are government geeks, you probably know that health is generally the purview of the county government, not the city. We run the fire department, the police department, parks, recs, libraries. We keep the streets paved. But health, you know, that's the county's business. But I will say, as the mayor of Oakland, I was beginning to see an increasing, alarming phenomenon. While Oakland, you know, had always had a few unsheltered individuals, it was never a visible problem before I was mayor. In fact, our point in time count for more than a decade had stayed relatively the same. And then our point in time count in 2017 took a giant step up. And by 2019, the unsheltered population in Oakland had doubled in just 4 years. In fact, in 2019's point in time count, Oakland, California saw one of the biggest increases in unsheltered homelessness of any city in California. Now, I had long answered the pleas of people, what are you doing about homelessness? And I very irresponsibly would answer, ask your county supervisors. It is their jurisdiction. And I, of all the things as mayor that I regret the most, was how long I continued to give that answer. It is all of our jobs to address homelessness. There is no greater moral imperative or soul-crushing failure of our democratic system than the fact that so many of our elders, our children, our fellow brothers and sisters live on the streets. And so I am so excited to be talking to a community of people who have dedicated themselves to changing that and recognize that housing is health. They are one and the same. You cannot have one without the other. So I want to talk a little bit about what I've learned on my journey from being someone who was not accepting the responsibility I should have accepted from my first day as mayor to where I am today and what I've learned. I first decided to engage myself in the issue of homelessness in Oakland when I was just so aghast at seeing the growing amount of encampments and started to do my own inquiries. And one of the things I found most shocking was that as I was seeing these encampments just growing and growing, every night in Oakland, according to my staff, we had empty beds in our homeless shelter. How can that be? And that's what set us on a journey that I truly believe is a journey, a direction for the rest of the nation, that we must move away from traditional congregate shelter. It is not humane, it is not dignified, it's not healthy. We were the first city, the first urban center to try these tiny little homes, and they're in my background. I don't have slides. This is how we can cheat on Zoom. We put our slides as our backgrounds. But these little cabins, some people call them tiny homes. I don't think they deserve to be called homes. They don't have plumbing in them. But we tried these tiny cabins. And what was unique about this model is we identified encampments that had become unhealthy, that had become unsafe. In this case, this was an encampment, a huge encampment that was right at the bottom of a freeway off-ramp. We had someone who was hit and killed who was living in that encampment because it was so close to speeding cars. We knew this was an untenable situation. So we identified an empty lot right next to where the encampment already was. So the place where the people, the unsheltered people, had formed a community and selected where they wanted that informal community to be. We brought essentially a shelter to them. We found this empty lot, actually it was owned by Caltrans. We put these little cabins up and we invited the entire community to relocate together. And that is when I learned about this thing called the Continuum of Care, and how normally using the criteria, the scoring of vulnerability that creates this kind of inhumane list where you have to be at the top of the list to get offered the next piece of housing, I learned that that system, which really evaluates the individual in isolation of where they are or who they've chosen to live around, that was really not working for cities. We had this dangerous situation, and it was a communal one, not an individual one. It was a place-based one, not just a matter of a health index and how each person scored on it. And because we raised private money to experiment with this intervention, we were able to move people into shelter, not using the Continuum of Care score, but recognizing a community that wanted to stay together, recognizing a place. Well, those cabin communities, one of our very first residents is the gentleman that you see right here, Bishop Emery. I met Bishop. He was living in a box at the bottom of that freeway off-ramp with his nephew, Sean. Everyone loved Bishop. This is him when he got his key to his cabin. There is something about people being able to go to bed at night behind a locked door with their partner, their pets, their possessions, and something they never get in traditional shelter, and that is their privacy. That is what the huge difference is between these non-congregate, non-traditional forms of shelter and what we offered. I understood from our street outreach people that traditionally when we had offered our congregate shelter, it was pretty impressive if even 50% accepted the offer. With this encampment, we had more than 90% of the individuals accept the offer to come into the cabins. The other thing we learned is people don't want to have to move their things. They want to be able to get something that they haven't gotten in years, and that's a good night's sleep. In fact, our next set of cabins, we upgraded with double paned windows so they could be absolutely silent. And what we found was when our unsheltered move in, they would normally sleep for 2 days. That is how badly their bodies needed sleep. Talk about a health issue. And talk about a health issue. The reason I also wanted to put Bishop Emery behind me while I spoke was for us all to remember that this is not about shelter beds or statistics or one form of a building versus another. This is about human beings and their lives. Bishop Emery moved into our cabin communities in 2018. By the end of that year, just before Christmas, I had the pleasure of visiting him in his permanent affordable apartment. I remember he kept a Bible open on his little kitchen table. He didn't know how to put together his bed, so our staff had to come and put together his bed. He was still sleeping on the cot that he took from his cabin. But I'm very sad to share with you that in July of 2019, just 6 months later, I attended Bishop's funeral. That every day we leave our neighbors on these streets, we are robbing them of their lives. And that even once we're able to stabilize them and get them into healthy, safe housing, we still have not ever taken away that health robbing experience of homelessness. So I just wanted to have him over my shoulder here to remind us all that this is why we do this work. One other thing I learned upon my journey of becoming someone who took responsibility for homelessness as a city mayor was the fact that at the time, there were no homelessness prevention programs. We had eviction defense, we had displacement programs, anti-displacement programs, but nothing that really was digging into how can we prevent people from becoming homeless. So many of our eviction defense programs required that you be a leaseholder, that you actually be on, a rental agreement. You were facing an eviction. What we learned was that most of our unsheltered neighbors had actually progressed. If Andrea Evans from Tipping Point can mute yourself, I'd appreciate it. Thank you. So we learned that there really wasn't a homelessness prevention program. So we created one. And once again, I cannot tell you how important public-private partnerships have been in Oakland's journey to addressing homelessness. To experiment, to take risks, to have permission to fail, to have permission to not get it right the first time, but iterate and improve it. Taxpayers are not always so forgiving about risk-taking with the public dollar. And that's why the role of philanthropy has been transformational in Oakland, because we've been able to test these things, prove that they work, bring that data to the governmental body, and then get public funding and institutionalize these new interventions as part of how the government does its work. Keep Oakland Housed was absolutely the same. We raised $15 million in seed funding. We put together a community of nonprofit providers that weren't just dedicated to figuring out how we could most effectively prevent homelessness, but also worked with one another to ensure that we were reaching the people that needed this help the most. Like I said, they weren't always people that were facing evictions. Those folks are often easier to find. They know they need a lawyer. These were folks that were couch surfing or staying in motels and occasionally in their cars. And because of the success of Keep Oakland Housed, we had hoped that in our first 2 years, we would prevent 2,500 households from becoming homeless. By the end of our first 2 years, we had actually kept more than 5,000 households from becoming homeless. These were all households that had experienced homelessness in the past, that were extremely low income. And one of the kind of secret sauces, one of my aha moments in hearing about what made Keep Oakland Housed successful, it wasn't just one-time cash assistance to pay off the back rent, pay off the utility bills that were owed. It wasn't just the legal support if someone needed it. It was the case management. We actually had case managers come in and look at how can we ensure that this household, after this one-time emergency assistance, has the ability to maintain an income, to maintain stable housing going forward without any more emergency assistance. And I can tell you that that is the ingredient that is often missing in the traditional displacement prevention programs. And it does remind us that so often government thinks that we know what someone needs, but that we must have more flexibility, especially in how we can use our funding. Sometimes I call it tweezer government, like oh, I can house, some people in this encampment, but you have to be a veteran because that's where my funding source is. It's only for veterans. Or you get to the top of the list because you have a child with you, and this funding that I have is only for families, only for parents with children. So this idea that we're tweezing out, each and every little type of population is crazy. Like, we've got to stop doing that. That's not how the world works. It's undignified, it's inhumane, and it's honestly not very effective. And so Keep Oakland Housed actually had flexible one-time funds. And my favorite story, one of the very first households that we helped was a very elderly mother who was being cared for by her adult son who was developmentally disabled. But the developmentally disabled adult in the household had been able to hold a job until their washing machine broke. His job required him to wear a clean uniform. When the washing machine broke, he tried to navigate a public laundromat. He just couldn't. His disability prevented him from being able to do that. Keep Oakland Housed bought them a new washing machine, so he was able to regain his job and stay stably employed. I don't know of any governmental programs that provide free washing machines. We really have to trust people to know what they need to be stable and financially secure, which translates into being financially and stably housed. Another thing that I learned through my journey, and I know Philip Magano is on this call. In fact, I think there's several people that I had the pleasure of serving on the governor's homelessness task force. We certainly learned that we've got to go big, and that a shelter mandate is not solving the problem. What we need is a housing mandate. So let me conclude my remarks by making 3 requests of you, the research community. Request number 1, please start everything you do with a race equity analysis. Everything we do will be better if we start by recognizing the insidiousness of systemic racism. We see it especially in homelessness. Oakland worked with Alameda County to do a systems modeling to really explore what our homelessness system was doing, whose needs it was meeting, and whose needs it wasn't meeting. We had a very fancy technical assistance person that was paid for by HUD. We brought in our racial equity expert to start with that race equity analysis. And the HUD TA provider said they will never do this work the same again, because watching how a race equity analysis changes their work was absolutely eye-opening for them. For example, one learning was something like Keep Oakland House, which provides only one-time emergency assistance, is not helping us close the racial divide, because racism is not a one-time emergency. It is a persistent condition that impacts people all along their lives. Our systems have to recognize that. My second request for you researchers is that implementation matters. It is not just about having some new policy idea, but studying and finding recommendations for how we can implement what we already know works better. And I would suggest that there is a treasure trove of potential data and research that could be done around the recent home key projects. I have never seen government move this quickly. I have never seen so many Californians moved from homeless to housed. How did that work? How can we move that quickly going forward? Please don't just study policy, study good implementation. And then finally, and most importantly, go for the forest. Sometimes I feel like researchers are like examining the veins in the leaf of the tree, like let alone the forest. We know that society is complex and interrelated. And so go for those big ideas like universal housing vouchers and guaranteed income. Look at the interconnectedness of everything. Don't just make me continue that tweezer government that I told you was so painful for me as a mayor. So those are my three requests to you as a research community. Thank you so much for being engaged in this work. It is the work. Thank you.
Thank you so much, Mayor Schaaf. I was just applauding the entire time, and I'm sure the audience was. And I want to move to Oakland. No, just kidding. But just thank you for your vision and for putting us on notice as researchers, the racial equity analysis, the implementation, and as you said, to think big, no tweezer analysis. And I wanted to also thank you for sharing with us Bishop Emery's story. So we don't have you on for questions, but I don't know if you might be interested, if there's any questions very quickly. I do think that you put researchers on notice. And so I know that I have colleagues here in the research community that certainly heard you loud and clear. So just seeing, I think
I will put a link to the racial equity analysis in the chat. I will actually put a link to the report in the chat.
Yeah, I think more and more as public health professionals that we are centering equity or leading with racial equity. And I know for our work at the Center for Health Policy Research, that is a value, that has been a value for us, an approach from, say, since the inception of the center with E.R. Brown. And I lead the California Health Interview Survey, and we lead with health equity. And not only is it the right thing to do, but it actually leads to the best analysis possible, particularly from a public health perspective. So I wanted to thank you. I want to move on, and thank you, Mayor Schaaf, to the next panel. And the next panel is going to be moderated by Andrea Evans. And Andrea Evans is, I'm going to just tee her off. If you could turn on your camera, and if all the panelists, please, could you turn on your camera? As we see. And Andrea Evans is the Director of Chronic Homelessness Initiative, Tipping Point Community. She is gracing us with both being moderator, but also contributing to this conversation. And we thank you Andrea. The bios, as I remind everyone, will be posted in chat so that we can move on with the conversation in this time that we have allotted. So Andrea, I'm going to hand it off to you.
Thanks very much. And good morning, everyone. It's really a pleasure to be with you today for what I'm sure will be a really interesting and thought-provoking conversation. We have a wonderful panel joining us today. Just a little bit overview of how we're going to move forward. So each panelist will give a presentation. At the conclusion of the final presentation, the third, I will exercise my moderator's privilege to ask a couple of questions, and then we'll open it up to the audience for broader Q&A. If you have, if someone says something that sparks a question while they're speaking, feel free to put it in the Q&A box. I'll do my very best to get as many questions as we can before the end of our time today. But without further ado on the logistics front, I would love to kick us off with just a quick overview of our first panelist today, and that is Philip Mangano. Philip is the president and CEO of the American Roundtable to Abolish Homelessness, which partners public and private sector leaders across the nation to upgrade their strategic response to homelessness and accelerate the scaling of needed units. Prior to that, Philip was appointed by President George W. Bush as executive director of the White House U.S. Interagency Council on Homelessness, where he shaped and led the national strategy to end homelessness from 2002 to 2009, overlapping with the early part of the Obama administration. He was also part of Governor Newsom's Council of Regional Homeless Advocates, and he currently serves as the vice chair of the VA Secretary's Advisory Board on Homeless Veterans in Los Angeles. I will turn it over to you, Philip.
Thank you so much, Andrea. Appreciate it. And I'm so glad to be with you. And my appreciation to all of the organizers. I know how much effort went into creating this forum on housing and homelessness. So I'm very appreciative of that focus and attention, of course. And it's always great to work with mayors. I spent a lot of the time I was in Washington traversing the country, working in partnership with mayors in local communities and with county executives and with governors. And one of those mayors that I was able to spend good time with and really appreciated was, of course, my friend, Mayor Bill Purcell, who we heard from earlier, and certainly his perspectives on the issue and the frame that he brings as formerly being a mayor and now a renewed frame from outside local government. I think that was incredibly helpful. And I got to know Mayor Schaaf when I served on the governor's, when we currently serve on the governor's homeless task force. And I know of her obvious personal concerns and her policy initiatives to remedy things there in Oakland. And having lived in Oakland somewhat, I'm appreciative to her for the efforts that she's made in a very difficult situation as she described it. So I'm very fortunate and blessed to be part of this initiative. Long ago, I was the director of homeless services for the city of Cambridge, Massachusetts. And as such, I had access to some of the best housing policy minds in the country, none less than Bill Apgar, who served in several presidential administrations, giving advice on housing and other issues related to housing. And of course, he was also the director of the Joint Center on Housing at Harvard and MIT. And as you know, each year they publish research on housing need in this nation. So we were very fortunate to have Bill Apgar as part of the resources that we had on this issue. He made himself available for our policy efforts related to homelessness in Greater Boston. And he taught us a frame to understand housing policy and the responses needed. He posited a ladder of housing need. And at the very top of that ladder of housing need are people who are contemplating second and third homes, where they should be, and what kind of governmental assistance or tax assistance they could get in that grappling. Down the ladder, he taught us about the needs of people who were attempting to and aspiring for home ownership. And then further down that ladder were those who were challenged by paying a great proportion of their income for rent, 50%, 70% of their earnings. Those seeking to live near their place of employment, of course, was part of those folk who are on that ladder of housing need. Far down the ladder, Bill taught us that the bottom three rungs of the ladder were broken out. And off the ladder of housing need were homeless people. And homeless people with all of the many profiles and circumstances they had, but nonetheless, they all shared an experience of being off the ladder, and they all shared an aspiration to get on that ladder, to end their homelessness, to have those bottom three rungs of the ladder restored so that in fact they could get back to what they most wanted in their life, to be absent from the long misery of homelessness and to be housed once again. Our job as policymakers and advocates is to restore those bottom three rungs, to ensure the promise of America that everyone, all of our neighbors, would be housed. I want to present some of the misunderstandings in policy that have so compromised our capacity to restore those rings and keep us from that promise of housing for all Americans. First, the misunderstanding that a concentration on the creation of so-called affordable housing would be a remedy to homelessness. What Bill Apgar taught us and what we've learned empirically over the years is that all levels of housing need a concentration, and that in fact, affordable housing never reaches down to the people who are at the bottom, who are off the ladder of housing, that without housing that is specifically focused and concentrated and targeted to the lives of homeless people, without that specificity, the needs of homeless people would remain unaddressed. Second, the misunderstanding that something less than a place to live, that is housing, would be an appropriate response to homelessness. When I first went to Washington, HUD's homeless resource sources were concentrated 80% on services and 20% on housing. That left very little housing being created, targeted to homeless people. And it was unresponsive to what the consumer most wanted, because consumers, when you ask them what they want, that is homeless consumers, they never ask for a pill, a program, or a protocol. They ask for a place to live. So housing needed to be central to policy making with regard to the lives of homeless people. Third, another misunderstanding is that this population, is that there's a bifurcation between housing and services, that you can talk about one without the other. In fact, what we've learned over the years, as Mayor Schaaf indicated, is that housing without services leaves people set up for failure. Services without housing leaves people languishing on our streets and living in our shelters. The reality is that housing may be the most important service that homeless people need, that housing itself is therapeutic. It's a therapeutic service and uplifts those lives as much as any other social service. Housing is the context, the nexus point for the delivery of other services and the provision of what homeless people need. It needs to be within the context of housing. And so, of course, we have to ask ourselves, what are the implications for systems if, in fact, there's not a bifurcation between housing and services? What silos need to be broken down so that housing and service components work together? What are the federal and state and local implications of that? And what about in California, where housing is usually a city function and social services are a county function? How can those be brought together? How can cooperation and coordination to ensure that that both are focused and both are are available to homeless people. That's a critical consideration. Fourth, the misunderstanding that simply offering capital dollars for housing for this population is a sufficient response. That somehow local jurisdictions will be able to secure and support and cobble together over time service component and the long-term operating expenses. That was one of the potential difficulties in the whole home key exercise of creating more housing. Fortunately, the state has been responsive to that and has made some adjustments to that in Home Key 2.0. The fifth and final misconception has been around housing first, which has become policy for our country and in most communities. The notion that housing first is simply housing without services is a misconception of what that issue, what that brings to the table. In fact, what housing first brings to the table is focused in customized services to support tenancies. The misconception that it's simply housing would bring us back to the failures of deinstitutionalization that left many of our mentally ill neighbors out on the street. So finally, what is missing that will, what has been done recently that went right? Well, first of all, policy focused around consumer preference, asking homeless people what they need. And that's exactly what Housing First is. That adoption in DC and around the country began a process by which housing could be scaled. We came to understand that the customer had it right, not the service providers, not necessarily the experts in government. And that our work, as Clay Christensen taught us in The Innovator's Dilemma, needs to be to listen to the customer and then implement what the customer needs. Second thing that went absolutely right is the investment targeted to homeless people of housing. And that's where Home Key is such an advance in a national model, creating 6,000 units last year, 15,000 this year, and 15,000 again next year. That will make an impact. That's where the scaling of housing, which is so required, is so imperative. We know what to do. We know how to do it. It's a question of scaling what makes a difference in homeless people's lives. Third, an increased sophistication in the provision of services has gone right. Assertive community treatment teams and other resources have made a difference in terms of not only engaging people on the street, but also stabilizing them in their housing. So there are some things that have gone in the right direction. And as I said, finally, in terms of what's missing that will make a difference, and that is understanding prevention more in a more sophisticated way and implementing protocols that will put a tourniquet on the hemorrhaging of people out of systems of care and onto the street and into shelter programs. And that means that other systems, whether it's the mental health system, substance abuse system, a variety of different systems, need to understand that their need to create a residential step-down capacity is critical. And finally, in terms of what's missing, is understanding the role of employment. Employment has been the orphan in housing policy for homeless people. So beyond simply offering resources to pay rent, employment also builds social capital and connectivity, which offers a sense of belonging. So some attention to those things that are missing, but certainly if I had to point to one thing that's gone right in California, it's the governor's concentration on Home Key and the scaling of housing resources that are specifically targeted to homeless people with the appropriate service. So thank you so much for having me.
Wow, thank you so much, Philip. That was a lot to take in, and I think we're going to have, a lot for conversation later in the hour. I want to go ahead and bring Bill Purcell into the conversation. As we noted, he has over 30 years in law, public service, and higher education. During his 8-year tenure as mayor of the Metropolitan Government of Nashville and Davidson counties, Tennessee, from 1999 to 2007, Nashville saw an unprecedented economic expansion, an increase in metro school funding of more than 50%, and the development of more than 26,000 affordable housing units. He was elected to a second term as mayor by a record-setting 84.8% of the vote. I don't know how that was possible. Maybe we can take that up another time, but impressive. And prior to mayor, he served 5 terms in the Tennessee House of Representatives, serving as majority leader from 1990 to 1996. I will turn it over to you now, Bill.
Thank you. And, it's a very special opportunity that I have to appear twice in such a short period of time, and hopefully improve on my performance in the first segment together with everyone, and also, frankly, to be in such good company on this particular in this segment. I'm not going to take all of my time because you know so much of what I think on the broader subject. I do want to reinforce what Philip said, both at the start and the conclusion of his remarks. It really is about all of housing. It really is about focusing on the entire need within a community. That's what mayors do. And I think Mayor Schaaf's understanding and frankly, the actions that she's taken are what the mayors that are successful are going to be doing. And that is focusing on that whole wide range of housing needs within their community, understanding that many are one washing machine away, one lost automobile away, one medical bill away from homelessness, and those who ultimately move into housing will have continuing needs, as do all of our citizens. So I think that notion that Philip introduced from the start and has so inspired his work for 40 years almost since his work in Cambridge stays front of mind. We have to focus on each need, but we have to think about all of housing together, because in the end, that's what our communities need, and that's what the people who both live there and are going to join us here need as well. I think Philip said, as Mayor Schaaf said, we do know what to do, and we do know who has to do it. The piece that is not fully established is what level of resources will be required. Interesting thing this year, as the federal government put first a moratorium in place and then began to pour resources into eviction moratoriums and opportunities to sustain people in housing, we noticed again how quickly cities can move, but also how challenged we are in the midst of a crisis. Understanding what we were able to do fast is worth studying, back to the public policy scholars on this call, but it's also worth improving as we move forward. The opportunity to bring services to bear quickly to keep people in housing as well as put people into housing. Same thing in the area of rehabilitation and protection of the existing housing stocks that we have. That is among the quickest and fastest and least expensive things we can do to maintain housing within our cities. But it requires our attention, and it requires resources. This is a year in which an extraordinary infusion of resources has begun, and we know that. But the promise of this time, I believe, in addition to policy and understanding where the work is done, is making sure there is a sustained level of resources to support those actions. It's a critical moment in time. And I'm not here to advocate for political action of one type or another, but I am here to say we are public advocates. And if we care about our cities and the people in them, then we need to advocate publicly for what is required. There are a number of different numbers out there. There are, again, the administration and governors have each made proposals, but at the core of it is a need sooner rather than later to bring resources back to bear to the policies we now know need to be implemented. Without those resources, we know what happens because we've lived through this. We lived through it in the middle of the last century. We lived through it, frankly, at the end of the last century, as resources for housing broadly, and certainly those most in need of housing, became either diminished or at a minimum flat and unincreasing. We watched as we failed to invest in desperately depreciated public housing stocks. We came forward with policy changes, fine, RAD conversion, other ideas about how one might use the resources we already have, but very infrequently did we bring new and significant resources to bear in order to meet the needs we already knew we had, and now to fund the policies that we know that work. So I don't want to leave this call today without that clarion statement. The need for us to have an agreement, what needs to be done, and then we have to pay for what needs to be done if we are going to sustain the health and well-being of our communities. And that's right in front of us right now this year.
Thank you so much for that, and for that little call to action there at the end. I think it'll be a great segue, and would love to just remind folks to put any questions that you have in the Q&A box, and we will try to get to them at the end of our presentations. I do want to introduce Eva Thibodeau Graciak. She is the CEO of Temenos Community Development Corporation and a licensed clinical social worker who has been working to end homelessness in the greater Houston area since 1997. She worked to transform the Houston area homeless response system from one of siloed and fragmented responses that largely neglected to serve the most vulnerable and at risk to a coordinated and collaborative group of partners that specifically focuses on housing those who are least able to make it to the front of the line on their own. She has served as a national trainer, speaker, and subject matter expert who has presented at domestic policy reviews at the White House. And I'd also just like to add that when Tipping Point was getting started on our initiative, we spent a lot of time talking to folks in Houston. This was before my time, so I'm not sure if you were part of that, those conversations, Eva, but we learned a whole lot about getting our coordinated entry system off the ground from you probably and your colleagues certainly. So thank you for that. And please, the floor is yours.
Wonderful, thank you so much. And yes, I do remember colleagues of yours from Tipping Point and lots of other places around the country, looking to Houston and what we did. And I have to say, well, I think that I'm placed at the exact right place on this panel. The three folks before me, I think really nailed a lot of the policy and the the framework of how we have to look at ending homelessness. And so instead of reiterating all of that, I want to put a little bit of detail on the bones that were set out and kind of talk about what we've done in Houston very, very specifically, and places where we're still really struggling. Ending homelessness is a very, very complex, social issue. And, it doesn't just happen in the homeless response system. And so, one of the things that really worked for Houston is that through a whole lot of what I call HUD love, which is Housing and Urban Development Department, just saturating us with technical assistance experts who really had done work and had been in places where things were working and homelessness was being driven down, particularly unsheltered homelessness, where we were pretty good at housing folks who could make it in congregate shelter settings, but the folks who couldn't continued to go out into the streets, continued to grow our unsheltered population, and we were not responding to that population at all. And so that's really where my expertise is in this housing first, permanent supportive housing, lots of services available and moving people directly from street to housing. We have a couple of oddities that you have to know about Texas and about Houston. We do not have any public mandate to house people if they're unsheltered. We do not have any publicly run shelters. So our congregate shelters are all faith-based and very programmatic. And we don't have, as a system, we don't have a whole lot of control over our shelters. And so we really had to learn how to get people to a place, both landlords, supportive service workers, outreach folks, where we were ready to bypass emergency shelter. The other thing about Texas in general is that we do not have expanded Medicaid. So the only way that someone who is poor is going to have any access to Medicaid in Texas is if they qualify for SSI. And then they also get Medicaid. The problem is that the Social Security Administration does not recognize substance use disorders as qualifying disabling conditions, which of course, so many of our most vulnerable chronically homeless individuals, they're experiencing a myriad of co-occurring disorders, one of them being substance use. And I would say in the housing the permanent supportive housing that Temenos owns and operates, we have about 65 to 70% of people who have zero income, zero other benefits. They're not eligible for food stamps. They're not eligible for healthcare, and they have no income because we target folks with co-occurring substance use disorders. So those are just a couple of context pieces. So once we started getting all this HUD love in 2011, we really came together as a community and made a commitment that we were going to put our organizational egos to the side, and that at every single convening that we had, every single question that we were trying to tackle, we were going to put that person or household experiencing the crisis and the indignity of homelessness in the center of our conversation. We said so many times, look, it's supposed to be hard for us. We get paid to show up and do this. We should not put, our administrative burdens on that person who's experiencing the crisis. And so keeping that laser focus on why we were doing this and why we were making huge paradigm shifts, with our boards, with our organizations, with where we put money. We really had to stay laser focused on why we were doing this, and that it wasn't about making my monitoring visit easier by having a client go to 12 different places to track down paperwork. Rather, that burden should be on me or my navigator, my outreach worker. So one of the early things that we did was we tried to make all of our money as flexible as possible. And that was even within our Department of Housing and Urban Development dollars, where people had very special designations for subpopulations that they served. We did everything that we could to work with HUD to do grant amendments to make it just be the most basic of what was eligible for that year. So for example, if you had to serve someone who met the federal definition of chronically homeless, then we made it so that you didn't also have only veterans and only HIV positive, or only, women with 2 children with left feet and half a thumb, because it was impossible to house people with all those restrictions on our units. The other thing that we did is we spent a lot of time with public and private funders coming together at the same table and really educating them about what best practices are, what emerging best practices are, and what the data says. And then equipping them to ask questions. We as a state and as local governments do not put money toward homelessness. We don't have a tax that goes for it, or for housing for that matter. So we really needed to look at what was existing and what all of the federal pass-through buckets of money were going to be, and align that whole group of people to be aligned around housing first, again, which is that idea of, and I love what you said, Philip, is, people, I've done street outreach for decades, right? No one ever asks for a pill, a program, or a protocol. I'm going to take that forward with me. And what they ask for is housing, and they don't ask for housing that's contingent on a pill, a program, or a protocol. They ask for housing. And so, that's what we give them. And when we started changing that conversation to saying, hey, we want to work with you, and we have folks on site to partner with you so that you can maintain your lease. And that's all that we want of you. So as a community, we embraced what's called harm reduction. And I'm not sure how much, the health researchers know on this, but, particularly in the substance use lens, we're looking at, okay, so you have a lease violation or a write-up because you are knocking on everyone's door, looking for money or providing favors, at 3 a.m. to try to get money for crack. Okay. So how about you don't do it at your own apartment complex, go somewhere else. That's harm reduction. We're talking about how do you maintain your lease, not about how do you, stop using substances. Or you might, get into altercations every time you're drinking too much. Well, guess what? You have your own place with a lock. Let's put a sign on your door when you go, in there, and it's going to be taped right over where you'd have to open your door. And it says, don't go out. I'm drunk. We'll get in fight. These are the real kind of like on the ground types of things that we use to help people keep their housing. As you can imagine, from a supportive services and nonprofit organization perspective, we had been entrenched in decades of, having to deserve housing, and you deserved housing by, being morally like, white, middle, and upper class people think they should be. And so we had to do a lot around that. Another thing that, okay, so we got all the funders together, got everyone moving in the same direction, on the same page, and made difficult decisions about taking money away from people who really had passion, but were not directing resources at the most severely in need. I think the other piece that we had to do was work with our partner systems, one of those being our workforce development folks, who typically, again, Phil, talking about those bottom rungs of the layer in housing not being there. Well, they're not there really in any of our systems, within our preventive healthcare system, within our mental health system, or within, our public income systems. People in those systems really firmly believe that unless you're housed, you cannot participate in those systems except on an emergency basis, whether it be day laboring, panhandling, going to the emergency room, or getting a psych commitment, which oftentimes ended up meaning our county jail. And so really working with folks to debunk that, those myths. One of the ways that we did it within healthcare is that we put together integrated care teams, and have them on site at places where we have clustered housing, or not congregate housing, but a higher concentration of housing. And so we have a nurse practitioner, a psych tech, and a community healthcare worker on the same team, located on site with our, substance use recovery coaches, and with our social workers, and our peer specialists. And so we're really saying, like, you can do this work. You can do it on the streets with us at outreach. You can also do it with people who are newly housed, and you can do it to keep people housed by coming to them. With our workforce folks, what we did was we actually, as a homeless response system, paid to staff positions where our workforce response system hired people out of the homeless response system to basically be, they call them docents, but to be docents at their high concentration, like near encampments, and high street homeless areas and shelter areas, to work in those offices and to be a resource to all of the staff there. So the expectation is that all of the staff would serve anyone who came in, but that, if you needed help, then you could call on the subject matter expert of the homeless response system to get that help. So those are some of the things that we did that really worked. And that, since 2012, we've housed 21,600 people in permanent housing. That's a combination of rapid rehousing, and permanent supportive housing. But, we doubled our permanent supportive housing units just by getting smarter, more effective, and more efficient with how we used existing dollars. And so, it can be done. We still have people who are unsheltered. I think that best practice of housing people encampment by encampment, keeping people who are relying on each other, and who call each other family, housed as a family unit. And then, certainly we have been very aggressive about using any and all money that comes through the city and county, and, demanding that there be a portion of it that specifically directs literally homeless. And so, we had Hurricane Harvey money that has gone through, or has gone toward, the homeless response system. And now with the COVID, all the various buckets of COVID money, we're doing the same thing. And in fact, we're front loading housing dollars, knowing that, vouchers and things will come available over time. And we're using the COVID dollars for the first, 2-3 years until those vouchers become available. I think obviously, and this has been said, unless we have, universal housing assistance, and until, other systems, I think, understand that, shelter and permanent housing is a really key part of intervening. In the homeless response, we're just going to keep, plugging the holes in the dam. So, we certainly haven't figured out how to stem the flow into homelessness. But I think if I had to, talk to researchers, let's say in the nonprofit world, homeless response nonprofits tend to be oftentimes a little bit smaller, maybe a little bit less resourced. They typically haven't had the kinds of kind of infrastructure and licensing guidelines as like a child protective, type of place, or educational or gerontology hospital kind of places. And so, we don't always know how to use your expertise. We don't know, we have the people, we have the data, and we would love for you to introduce yourselves to us so that you can help tell our story through research.
Thank you, Eva. I think that was an introduction for everybody to come together and continue the conversation. Thanks so much for kind of really helping to ground some of those policy ideas and what you see every day in your supportive housing programs in Houston, and for sharing some of the successes that you've had especially the last 10 years or so. It was such a rich conversation and so many examples. And I think in some form or fashion, all three of you said, we know what works here. We know what we need to do. There's a question of scale. There's a question of resources to get to scale. And we know, or at least there's a lot of indications that the federal government is willing to play a much more bigger role in homelessness and housing in the next couple of years. So this is a question to really anybody on the panel. I'm wondering what your thoughts are on how we can best take advantage of this opportunity, and where you would recommend, the lion's share of the resources that will be coming from the federal government. Where do you think they should go?
Well, it is a wonderful thing to see the federal government re-engaged, as they have that $5 billion of home money targeted to homelessness, and how it will be affixed to the issue. I do think, and I'm proud to say this, that California is leading the way. The initiative of the governor in specifying the creation of units. If you go to any city in this country and ask the providers in that city, what is the greatest impediment to getting the job done on homelessness? What's the greatest impediment to accomplishing the mission? They'll tell you it's a lack of units, lack of accessing units. And that's why it's so important to create units that are specifically targeted to homeless people. We've done a good job of accessing community-based units with housing search and the like, but without units that are specifically targeted to homeless people, it won't get done. And precisely what HomeKey did, several $1 billion this year, several $1 billion next year, will create those units that are missing in communities and allow more homeless people to move off the street, out of shelters, and into housing. And that is the central antidote, place to live. All of the other services that need to be provided are best more efficiently and more effectively provided within the context of housing. So I would say California leads on this by quite a large margin, with all due deference to Houston and the great work that's been done. Obviously, 21,000 units, you recognize that without the units, a lot of the work goes on endlessly. We're busy serving people endlessly rather than ending their homelessness. But certainly California, I think the model is, and I think that's one of the reasons why the Biden administration adopted in its home money the notion of hotel motel conversion, because if you want to be opportunistic on homelessness and you want to scale units, that's an avenue to do it. Who knows what it will be in the future? It might be refurbishing office space or movie theaters, because that might be the opportunity. But right now, hotels and motels are what's driving scaling. And that's something in California that the Biden administration picked up on. So I think more emphasis in Washington on kind of getting out of the way a little bit and focusing on the units that need to be created, that would be very helpful.
So during the time that you were in Washington, these issues were not wedge issues, partisan issues for our federal leaders. And we saw an effort, I don't think successful, but there was an effort to insert this wedge in the last season. And the insertion of the wedge was designed to divide suburbs from cities and people from each other and so forth. And so if you don't mind, it would be, I think, worth reflecting a bit on a time when there was agreement, and it's not 100 years ago, it's not 50 years ago, it's a decade ago, about the importance of these issues and people being together about them, and certainly not politicizing something which at the core of every conversation we've had here is not political in that way.
I think my staff, when I was in Washington, they computed that I made about 1,000 speeches during my years in Washington, just peripatetically going around the country, attempting to move the best practices forward and next practices forward. Part of every one of those speeches was the idea that homelessness, there's no D and there's no R in homelessness. We're simply Americans attempting to remedy a national malady. And that was the spirit, I think, that we had, and it was contiguous with previous administrations. There was no attempt to politicize this issue. In fact, one of the first meetings I had when I went to Washington after I had been appointed to head the U.S. Interagency Council on Homelessness was with Andy Card, who was the chief of staff to President Bush. And one of the issues I was bringing to him was, as you may remember, President Bush wasn't terribly popular around the country at that time, especially among Democrats. And so I wanted to make sure with him that there would be no political implications to what we were doing. We were just simply out there trying to solve a problem. And Andy Card made it clear that not only did we not want to in any way make this issue political, but he made a promise to me that the president would not speak of this issue. Because, of course, if the president spoke of it, that could be conceived of as a way of politicizing. We're doing a good job. We're moving beyond what was done in the past. And so in that administration, there was a defined discipline with regard to the issue of homelessness, which allowed me to go to mayors like you, Bill Purcell, and mayors like Gavin Newsom in San Francisco and Mayor Daley in Chicago and so on and so forth, that this was, we had some credibility on the issue because we weren't going to capitalize on the issue. So I think your point is well taken, Bill, that anything that politicizes this issue, anything that moves it from D and R's together, moving forward to remedy this wrong in our country, that diminishes the impact that we make from Washington. And I know that was part of what you did in Nashville, Bill. And you actually made it possible for me to get together with then governor of Tennessee, Phil Bredesen. And we were able to crack through and have him do a state interagency council on homelessness. So there is no question that your point is well taken. Anything that moves us away from politics on the issue of homelessness actually benefits homeless people. And I think that needs to be a continuing part of the conversation. And I think that's an important conversation to have with the current administration.
Yeah, thanks very much for that. I wanted to just ask one more question before we open it up, since the focus really is around healthcare and housing, and wondering what examples you have seen, they can be successful or not, of really trying to integrate behavioral health, our behavioral health systems, our medical systems with the homelessness response system. Because I often find that we expect the homelessness response system to solve for everything, but there's child welfare, there's the justice system, which has a huge impact on homelessness. There's so many other systems that are connected that need to play roles themselves. And I'm wondering particularly around behavioral healthcare, if you've seen examples where they've really been able to integrate that in a way that's, improve the lives of people experiencing homelessness. I'll turn it over to you, Eva, first, and then go from there.
Thanks. Yeah, certainly, again, in our permanent supportive housing here, every single care team is an integrated care team that has behavioral health specialists on it. And literally, the team co-offices, they draw on each other's strengths. Now, really getting to a point where those folks are coming to the table with all that they have, we've used a series of who has influence over the head of that organization, who knows someone on that board, who can do that, to really try to to engage the top leadership and decision makers who can decide, really what the policy is and where the money goes, right? And get them at our governance table. And so, we've pulled in, child welfare services, we've pulled in our mental health administrator, our, public hospital districts, and our veterans, which is that's a little bit more intuitive for our VA than the other systems, to really be on this board of folks who decide the direction and are responsible for overseeing all the work of, ending and reducing homelessness in our system. And so when they're there, they get a valuable education. They also start to recognize that, if they can shift some of their resources, which may be less significant in their entire world, they can make an unbelievable impact on ending and reducing homelessness.
And I would just add to that, and I so much appreciate Eva's local perspective on this and doing it on the ground and putting things together. On a more macro level, exactly what we've seen in the last number of years is more attention to the healthcare resource, recognizing that homeless people are in need of every healthcare. One or another homeless person is in need of all of the behavioral health, all of the physical health, all of the kinds of health resources that are available. So whether you look at Medicaid on a federal level, which has broadened what it's willing to do, literally, our hope was that Medicaid would provide the money for housing. They have not gone there yet, but they will take you all, if you have the full waiver, they'll, exactly, amen. They will give you the resources, take a homeless person right to the threshold of housing, and then provide the resources for the services to support that homeless person in the housing. So they've been responsive to kind of a pincer movement from a variety of states who have really advocated for housing to be part of the Medicaid. My friend Jim O'Connell, who's done healthcare for the homeless in Boston for years and years, he says he longs for the day that the prescription he writes for a homeless person when he sees them on the street, you've all heard this, the prescription will say a place to live, and then that is a redeemable prescription at the local HUD office or at the local housing development office. But in addition to Medicaid's expansion, managed care has started to understand that it's in their best interest to be responsive on homelessness. Many of the high flyers in that system are the people who cost the most to that system are in fact people who are experiencing chronic homelessness. So what we've seen on a county level, I do some work in San Bernardino County in California, is that the managed care providers have stepped up and made resources available specifically to target the services, and also have made resources available for housing as well. Behavioral health departments in San Francisco and in Los Angeles have provided resources that will not only provide the health resources, but will pay for the housing. So there has been a step up at the federal level, at the state level, the county level, in terms of those variety of systems, and behavioral health would be another one where, again, in San Bernardino County, the behavioral health system understands that some of its most disabled folk are people experiencing chronic homelessness. So there has been a general movement of health resources in the direction that we would like to see on homelessness. Of course, we can see where it needs to be rounded out further in other systems. And the final thing I'll say on this is that we have some research being done in this country right now on the collecting integration data, all of the administrative data in a county or in a city that tells us how frequently a person hits a variety of different systems. That kind of integrated data will allow us to more efficiently serve people and frankly, more cost effectively serve them, to serve them in a more holistic way. So the very provision of research that determines integrated data sets, that's incredibly helpful as well.
Yeah, that's fantastic. We're getting a bunch of things coming into the Q&A, so I want to be sure to get to at least a couple of them before our time ends. The first was from Sharon Rapport at CSH, and it's a question really about home key. I'll just kind of summarize it because it's a little lengthy, but I think the gist of it is that most of the home key units have been used for interim or shelter stays, and wondering if there's a concern that the new home key program will be likewise, mostly around shelter and interim rather than housing, and wondering if someone might be able to comment on that.
Sharon, of course, is part of the governor's
I know.
and she has rightful concerns on that issue. And part of that stems from the initial foray into hotel motel conversion and utilizing hotel and motel rooms was actually a response to COVID. The governor used the resources he had from COVID to rent hotel rooms and to place people into the hotel rooms on a transitional, temporary basis. But I would say that it's clear to the governor now that the new investment through Home Key is to create permanent housing units targeted to homeless people. And all of the counties and cities that I've talked to in the last couple of months are excited about the provision of this deeper resource specifically to create housing. So I think there will be a move away from simply renting motel rooms, which leads, of course, to the temporary use, to actually owning the motel room and determining who can go into that room. And the determination is it's homeless people who will have access to those tenancies. So it's a worthy concern, but I think we've turned the corner on that. And the private sector has also gotten involved in terms of purchasing units and placing homeless people there as well. So I think the trajectory for Home Key is the appropriate tenancy trajectory.
Yeah, I'll just add that in San Francisco, with our first Home Key allocation of funding, we were able to buy 2 hotels that are providing over 300 units of housing for people experiencing homelessness. And we are in the process of applying for 4 more hotels. Not all of them, I think, will get Home Key funding, but to bring another 338 units online before the end of the year. So permanent housing definitely being made available. There are several questions, and I hope I get this name correct, from Riza. I'll jump to the middle one. It's a question around whether, well, it says that 50% of California real estate actually belongs to the government. And so I don't want to necessarily limit this to California so that the other panelists can jump in as well, because I imagine that in Houston and in Tennessee, there's a lot of government ownership of land as well. And wondering if there have been studies of potential sites that might be used for dignified homeless encampments, or perhaps other uses for people experiencing homelessness. So anyone can jump in there.
You know, I will say that we have, we certainly have that. Houston also has the oddity of having no zoning. We just don't have zoning laws. However, we do have elected officials, and, the pressure on them from their constituents when, anything that has homelessness even associated with it, the pressure that they feel to not approve it is very high. and as a cohort, a lot of our elected officials, they kind of get each other's backs. And so we have not been able to, I would say, we've not been able to use that at this point as much as we would like to.
There has been considerable discussion about public land and the availability of public land. In fact, in the Biden administration's most recent releases in this area, they encourage local and state governments to look again, revisit the issue of land. At the core of it, of course, though, you don't want to be you want to be part of the community. You want to be part of the city. You need to be near the services. A lot of public land, California and everywhere else, is not in that space. The issue of land and location is central to ultimately providing the units that both Philip and Eva have described. But it connects back to the issue of resources. Public land has value, private land has value. In both cases, it's a question of resources and utilizing those resources. I know we're about to run out of time. Let me just quickly say, as we were talking, I was reminded that Albert Schweitzer once said that happiness is nothing more than good health and a bad memory. There is every reason to think if we as people who care about our cities and our communities, this period of increasing homelessness can really just be a part of memory. There is no reason that it has to be in front of our cities. And in fact, as I know Assemblymember Bill Ting is going to talk in a moment, it stands in the way, not just of their futures and their children's futures, but the success of our cities and our states and ultimately our nation. And that's why I again thank you all, especially Andrea, for bringing us to this point again, because it's right in front of us right now, and we must deal with it.
Well, thank you for wrapping us on a high note there. I think we're all ready to take up that baton and take advantage of this opportunity. So thanks again to the three of you for really wonderful and inspirational remarks. Really enjoyed having you, and I will turn it back over to the UCLA team to introduce our next speaker. Thank you.
Thank you. Thank you so much, especially to Andrea Evans from Tipping Point, to our speakers, Philip Mangano, Eva Thibodeau, thank you for your perspectives from Houston, and to Bill Purcell for, again, the view of both, what mayors should do, and both from the legislative perspective and from a national perspective. So it was a very powerful discussion, and I thank everyone. I hope you've enjoyed our first few sessions and speakers, and I'm delighted now to introduce our next speaker. Our next speaker is a leading voice on helping build consensus in setting California's fiscal priorities, and who has made addressing our homelessness crisis a top budget priority. Please join me in welcoming Assemblymember Phil Ting, who serves as both the California State Assembly member for the 19th Assembly District, as well as the chair of the Assembly Budget Committee. Honorable Phil Ting.
Hi, Dr. Ponce. How are you doing? Having difficulty starting my video, but happy to.
Oh, we just saw you. We just saw you a minute ago. So.
Yeah, it says the host is, there you go. Thank you.
All right, great.
Welcome. Thanks so much, Dr. Ponce, for having me and for hosting this very important discussion. Let me just first start off by saying I think the last panel really started off or just finished on a very high note. Our biggest challenge with homelessness today isn't what people always think of as the major issue, which is the people who are chronically homeless and the people who really elicit the greatest reaction from from the larger public. It really is the lack of housing, both affordable housing and market rate housing all over our very state. I'm very hopeful because what we see is a generation of younger people between the ages of 20 and 40 really start to get much more active on this issue of housing and really the need to build more housing. I mean, Eva just talked about it very much just earlier. It's very difficult to build housing in this state because everybody's for housing, they're just for housing 50 miles away from where they live. And so we have been looking at a whole host of streamlining measures and different proposals to really make it easier to build housing. The governor just signed SB 9, SB 10, and if you really had heard from the opposition, you would thought that once the governor signed those bills that, hundreds of thousands of units of housing would really be on its way immediately. And while I was very supportive of those pieces of legislation, that's not really the case. Those are very important pieces of legislation, but in terms of the overall impact, in terms of number of units, it's still nowhere near the millions of housing units that we're actually going to need. So I think we do need to continue to take a hard look at what the state can do, because frankly, local governments are really failing us. Local governments, city councils get elected by local voters, and those local voters are very much not in favor of building housing overall in their local communities. And so as a state level, we are working to try to ensure that we're doing our part to build more housing. Now, from a budget point of view, I was really proud to champion a couple of years ago the first budget appropriations for cities, counties, and continuums of care for temporary shelter as well as permanent supportive housing. What we saw this homelessness as an emergency. We want to take emergency reaction, so we gave them emergency money over a couple years. We finally, for the first time, appropriated $1 billion in this year's budget with the commitment that it's going to be over 2 years. So I'm very excited to announce that. But on top of it, it's really just a drop in the bucket, because I know there's a lot of tension between, should we do emergency shelter, should we do permanent supportive housing? And I would say we have to do all of the above. We can't really be caught in this a dichotomy of whether we want permanent housing or emergency housing. We have to get people off the streets today. While Home Key, Project Home Key has been a success in getting about 22,000 people off the streets, we have this eviction moratorium that lapsed starting October 1st. We anticipate evictions, potentially more people coming onto the street if we can't get landlords and tenants to kind of work together to take advantage of all the federal aid that we appropriated to local governments and all over the state. We still have about 150,000 people still living on our streets today. And it's very difficult to get them into permanent supportive housing if we don't get them off the streets into some sort of interim solution, which is why I've become very supportive of interim solutions, but also supportive of permanent supportive housing and permanent affordable housing. That's why in terms of our budget, we added $1 billion in terms of human services, social services, to do much of that hand-holding with many of these families that is so needed. You have families that just need to know how to navigate and how to figure out where these programs are, how to get them the help that they qualify for and desperately need, and far too many times easily fall off those programs. We also did $2 billion of affordable housing, and that was $1.7 billion of shovel-ready, affordable housing projects that were ready to go, just didn't have money. And so that we hope those units will hopefully be getting built over the next 4 years. Also $300 million of the preservation for existing affordable housing, and then another $130 million, which went to farm worker housing. And that's too often a population that we don't talk about. We really relied on farm workers, the Latino community, heavily depend on the Latino community to pick our grapes, to pick our food, to make sure that during this pandemic, while we stayed at home, we could still have food on our table. But that community paid a huge cost in terms of huge COVID rates. They continue to transmit COVID because they were the one that continued to forced into work. And so again, making sure that they have access to much better housing is so important. And then lastly, another $750 million to help local governments plan and meet their housing goals. That's one of the problems we constantly hear is communities want to have local control. They want to be able to determine how to build housing themselves, but yet they don't really have a plan or really haven't thought through how to really do this. And so these are some of the solutions that we're looking at. I was also proud to champion accessory dwelling units a couple years ago to streamline that process. In San Francisco, we call them in-laws. And what we're seeing is so many property owners are really very excited about doing in-laws and building out accessory dwelling units. And so hopefully, as we make this easier for them to build and we can get them financing, we're going to see upwards of potentially 50,000 ADUs a year that will get built in California. Still a great piece of the puzzle, but nowhere near the solution that we need in terms of the millions of housing units that we have. And I think, Bill kind of touched on this. One of the major reasons I'm very concerned is, as a state in California, while we're the largest state, we're the largest state because we are a destination. People want to come to this state from all over the world and all over this country because they want to come here to pursue their dreams. They want to come here because they see opportunity, both economic opportunity, but just opportunity for them to be themselves. There's great acceptance in many communities of folks from all over the world that people come here to be with others like them. I was lucky enough to be born and raised here, but my parents are immigrants, and they also saw California as this amazing land of opportunity. Both my folks constantly remind me of that every single day. Now, one of our challenges is if we can no longer accommodate people moving here, whether they're immigrants or whether they're just migrants from other parts of the country, we're going to have a hard time sustaining our economy and continuing to grow our fabulous state. And so I'm so worried that we have a generation of people who can't afford to buy housing or are spending so much of their money renting housing that they're going to be shut out of the California dream. And what's going to happen with them? We see many of them, younger families, I'm sure you've all heard it, they contemplate moving to Colorado, contemplating moving to Texas, contemplating moving back to whatever community they may have come from to be closer to family, be closer to friends. And that really is a trend that we're seeing in California that's very, very concerning to me. I know that the press always latches on to people like Larry Ellison or Elon Musk, and I'm not really worried where multi-billionaires want to live. They all have 10, 20 homes. They could decide for tax purposes to be living in any particular place, whether it's Hawaii or Texas or Colorado or Switzerland or other parts of Europe. We have limited control over that. But what we do have control over is the desire to build more housing. We really need our communities everybody to do their part, and that way we can have make sure that we have a generation of young people who, many of whom are, almost all of whom are currently employed. They're in good jobs, in good paying jobs, and we see that all throughout the tech sector, all over the Bay Area. They're in high paying tech jobs, but yet they still can't afford to buy a home. They still can't afford to live the way that many people coming out of college lived 20, 30 years ago. And so this is a major issue for California. I know that before we started grappling with this COVID pandemic, Governor Newsom dedicated his entire state of the state to housing and homelessness, and it continues to remain the issue, frankly, of our time. We simply have to find the will in our communities to continue to build housing. We really have to push back against this NIMBYism. And what we see is people who are very open-minded talk about wanting to build housing, and they're very pro-housing until there's an apartment complex next door, or until there's housing development a few doors down. Then they become just like everybody else and wanting to oppose it. So I think we really need to think hard about what every community needs to look like, how much more housing we can build, and then also making sure that it's not only just market rate housing that's getting built, but also affordable housing and permanent supportive housing. It's ironic at times that people continue to oppose market rate housing. And we even talked about how difficult it is to build supportive housing as well as affordable housing. And so that's why the state is really taking a much more proactive role in making sure it's easier for builders to build those types of units, because we really have seen a challenge with local control, where local city council members who get elected by their neighbors have a very difficult time approving additional housing. I think one example that we constantly talk about is Cupertino. Cupertino is very proud of the brand new Apple headquarters, which continue to add thousands and thousands of jobs to Cupertino. But yet, right after they approved the new Apple headquarters, and as the Apple headquarters was getting built, they continued to deny the request of permits to build more housing. They have an empty mall that's been the site of a large fight around a housing development, because you have an empty mall, which has now become an eyesore, but they'd rather have the empty mall than actually build hundreds of units of housing very close to the Apple headquarters, and very close to so many other jobs in the Silicon Valley. So, really appreciate all the speakers today for highlighting the issues. I know that we had a great panel before. I see many of the speakers who are coming on later who are really talking about the crux of the issue. I think that we really shouldn't be forcing ourselves into making these difficult choices. I know that people always talk about, well, we don't want to do temporary housing, emergency housing at the expense of permanent supportive housing. I think what we have to say is, you're absolutely right. We shouldn't have to choose one or the other. We have to absolutely do both. We have to have new solutions where we are doing emergency housing today. We absolutely have to have solutions where we're making it easier to build permanent housing, both market rate and affordable and supportive housing. And at the state level, I'm really hoping that many of you will engage and just make your voices heard to continue to support our efforts to make it easier, and frankly, have to push back against many of the cities and local governments. So really appreciate Dr. Ponce, you and your team for organizing this great session. Thanks so much for having me on. And again, thank you so much for bringing all these incredible thinkers together to talk about this very important issue.
Thank you so much, Honorable Phil Ting. Thank you for the invitation to make our voices heard from a community of not just researchers, but activists and frontline service delivery folks here. So you said a few provocative things about local government, but I think that this will unfold in the rest of today as well as tomorrow. And stay tuned, because we're going to come up with a policy piece that we hope that you and your colleagues will take notice of. So we wanted to thank you for your time today, and for our community here of listeners and engagers. We will take a very short 5-minute break. Thank you.
Thank you. Thanks for having me. And look forward to hearing those suggestions.
Great. All right, we're at 11:35 Pacific time, and hope you had a good short break. And just again wanted to thank all of you for joining us today, and to our speakers for the whole program. It's been already in the space of 2 hours. We've heard solutions, we've heard challenges, we've heard the way forward, both from the researcher perspective, as well as for the implementers, policymakers perspective. So welcome back. And I'm very, very excited to moderate this next panel. And often we speak of homelessness, there's stereotypes, and there's a facelessness, right, of the homeless population. But today we're going to bring several perspectives from our speakers on the impact of homelessness on marginalized communities. And we're allocating an hour and 15 for this discussion, this very important discussion. And let's get it started. I am not going to, yes, it'll be a discussion, no slides. It's bring your passion at the forefront. And by the way, Michelle, there were already questions about behavioral health in the previous panel. So the order is going to be Margot Kuschel first, who's the director of UCSF Center for Vulnerable Populations, and then Catherine Monet, who's the CEO of the National Coalition for Homeless Veterans. And then with Dana White, who is the program officer for True Colors United. Welcome, Dana, good to see you. And then we'll end with, well, I'm sure it's not gonna be an end, Michelle. We will continue then this discussion with Michelle Doty Cabrera, who is the executive director from the County Behavioral Health Directors Association of California. For those of you who just joined us, Mayor Libby Schaaf had talked about, she thought, health was a county, that's a jurisdiction, and now as a mayor of a city, that she saw that it was very important then to think about the ties between health and homelessness. And many of our speakers today, starting with Honorable Bill Purcell from Tennessee, was mayor of Tennessee, also put that framework. And then our speakers here, Eva Thibodeau Graciak, and Philip Mangano, who, in talking to many of you, everybody seems to know Philip. So thank you, Philip, for your insights, and of course for the insights and moderation of Andrea Evans again from Tipping Point. So let's get this started. Margot, you're up first.
Great, thank you so much for inviting me, and I'm so honored to be on with these incredible panelists. I want to maybe do some frame setting here as a physician, and I think for many of us, that even those who aren't physicians, when people talk about homelessness, they often lean into individual vulnerabilities. They tell a story of mental health and substance use, and if we could only get those systems working better, we would solve our problems. And I want to push back on that. I want to talk about homelessness really as, we talk about it as an interaction between structural factors, so things like the availability of affordable housing and structural racism, individual vulnerabilities, substance use disorders and mental health disabilities definitely put people at higher risk of homelessness, and the presence or the absence of a safety net. Things like, do we have income support, unemployment insurance? Do we have safety net healthcare and the like? And when the structural factors and safety net are less robust, you need fewer individual vulnerabilities to become homeless. In the United States today, I think we can all agree that our structural factors and safety net are fraying, and that is why we see what's on the street. That is not to say that people with mental health and substance use disabilities are not at higher risk, but that is not ultimately the cause. And let me just walk you through why I think that the causes of homelessness are really three very interrelated factors: structural racism, which we have to center any discussion of homelessness on; income inequality, which is of course related to racism, as well as the lack of affordable housing, and more specifically, the lack of what we call extremely low income housing, or that housing that's affordable to the lowest income households, or households that make less than 30% of the median income of the area that they live in. We cannot have any conversation about homelessness or housing insecurity without naming structural racism as a cause. I want to remind everyone that in this country, home ownership has been a primary means of intergenerational wealth transfer, and that until very recently in our history, Black and Brown Americans were completely consistent with the law. It was completely unethical, racist, and immoral, but it was not illegal until relatively recently in our history, excluded from, basically effectively excluded from home ownership through practices like redlining, so certain neighborhoods had racial covenants where they could actually say, you can only buy property here if you're white. And then the banks were allowed to say, by the way, if you can buy property in the areas that Black and Brown folks are allowed to buy in, we don't have to give you a mortgage, or we can charge you usurious rate. Things like the GI Bill and mortgage, benefits really flowed to white households, as did all federally backed mortgages. That is one of the main drivers, not the only one, but one of the main drivers of the enormous wealth inequality that we see today between white and Black Americans, as well as things like the home ownership gap. Even though fair housing laws were passed in the late 1960s, we know that they are not really enacted fully. They're not, kept track of, so that we know from really good evidence that Black and Brown households, when they go to rent housing now, and if they show up to rent housing and they have the same, they basically have the same housing resume as a white household, they're less likely to get it. This is illegal, but happens all the time. And therefore, Black and Brown households wind up spending more for the same housing, as well as things like the foreclosure crisis in 2008, which really targeted Black and Brown homeowners and caused an incredibly disparate rate in foreclosure. You add that to the known sort of racism that determines things like employment, and the racism in the criminal justice system and the educational system, which of course tracks to where people live, which are still in these redlined neighborhoods. It is perhaps not a surprise that Black Americans are 3- to 4-fold increased risk of homelessness compared to white Americans, Indigenous Americans in even higher risk. When we talk about income inequality and extremely low income housing, really, really important to note that when you look nationally of where homelessness is highest, it does not track highest where there's more mental health and substance use. It tracks highest where there's less availability of ELI housing and where housing costs are more out of control, which are often in these areas of high income inequality. California is currently the second worst state in the nation in terms of extremely low income housing. We have only 24 units of housing that is both affordable and available for every 100 extremely low income households, meaning in California alone, we're short 1 million units of ELI housing. And just to make the point, ELI households are disproportionately Black and Brown households. For instance, 20% of Black households are extremely low income renters compared to 6% of white households. We see this enormous racial gap in homelessness nationwide. 39% of those experiencing homelessness identify as being Black Americans, where only 13% of all Americans identify as being Black. And in many cities in California, we see an even worse racial gap. In San Francisco, less than 5% of the population identifies as being Black, and 37% of those experiencing homelessness does. We see this not only in homelessness, but in all aspects of housing. So we see high rates of housing overcrowding. So for instance, in the pandemic, we saw this disproportionate impact of COVID in Latinx households, where many were essential workers in vastly overcrowded housing. We see, because of all of these inequities, so much more housing overcrowding. What we know then is that the solutions are going to come through fixing these things. And what I like to say is everybody needs housing that they can afford. Some need support and able to live in it. That's where you see sort of permanent supportive housing. Some needs a lot of support, some needs little support, and some just need housing. Some just need housing that they can afford. But I want to remind everyone that we have really good high quality evidence that basically everybody can be housed, even people with severe disabling behavioral health conditions. We have incredibly high quality evidence that with the right supports, which are really the disability supports or the disability accommodations that folks need, we can succeed in housing everyone. So I guess as I close up my remarks and turn it over to my panelists, I just want to make sure that we elevate the discussion of the ways that structural racism has played out in this impact, ask you to have a relentless focus on increasing access to extremely low income housing, to push back against the individual narrative, which really plays into both racist stereotypes and ableist stereotypes, to offer our full support for vouchers. Only 1 in 4 households that are qualify for rental assistance currently get it. There's discussion in Congress right now about dramatically expanding that. We all need to be on the phones, calling our representatives, doing everything we can to continue that messaging and to remind us how important it will be for federal support as well as the local issues around zoning and things. And as a physician, I invite you to join me in my tagline, which is that there is no medicine as powerful as housing. Thanks so much. Look forward to the conversation.
Thanks so much, Margot. It's certainly consistent with what Mayor Purcell said this morning in her opening remarks about starting with a racial equity analysis and consistent with Assemblymember Phil Ting and the invitation to be loud for this community with different perspectives and hopefully intersections across state, counties, cities, services versus shelter, that this forum is a way to hear the collective voices. So our next speaker is Catherine Monet. And so Catherine Monet, I'm doing a very short introduction, so apologies. You will have Catherine Monet's full bio on chat. She's CEO of the National Coalition for Homeless Veterans. Catherine.
Well, thank you so much for having me join you today. I hate being behind people who I agree with very much, because now I'm like, yes, everything that Dr. Kushel said, plus. So I'm gonna kind of dive in a little bit to what I was going to say, right? I think her focus on inequities is absolutely right. We see that in the veteran population, but I do think the veteran population is a little bit distinct because of who serves in the military, right? We do know that we've seen really big decreases in veteran homelessness, a 50% decrease since 2009, which is amazing, but we still have over 37,000 veterans unsheltered right now, and about 30% of them are in California. So we do have a lot of work to do, right? We do know that veterans, as compared to civilians, are predominantly counted as individuals versus in families. Only 9% of them are women, as opposed to the about 40% that you see in the civilian population. The racial inequities persist, right? 33% of them are Black versus 12% of actual veterans who exist in the country. And we have seen a little bit of a decrease between 2019 and 2020, which is, I think, the first time in quite some time that we've seen an increase in veteran homelessness, which is troubling since those numbers are from even before the pandemic started. When we talk about risk factors, there are kind of the general poverty-related factors that everyone struggles with, right? An affordable housing crisis, underemployment and unemployment, and a minimum wage that has not increased in quite some time, where the cost of housing has increased dramatically. We still have some folks who struggle with access to health and mental health care because VA is not accessible to every single person who has served in the military. There are the race-related factors that Dr. Kushel mentioned, the income and wealth gap, housing discrimination. I'd also like to add one to the conversation, and that is mass incarceration, because of the ways that it is a feeder into the homeless system, but also because of the ways that communities are starting to approach the way that they, I guess, deal with the homeless population in their communities and the unsheltered population. There are some few military and veteran specific factors that I'm going to touch a little bit on, including Iraqi reintegration into civilian life, where you're coming off of active duty and struggling to kind of get acclimated to life outside of the military. Some folks are, still dealing with lingering post-traumatic stress or military sexual trauma related issues, and all of the compounding factors that I guess manifest. And then I think the last one that I will touch on really briefly is transferability of your military occupational specialty to civilian employment, where certain folks have jobs that just don't necessarily translate into civilian life, like sniper or things like that. When you look at homelessness, right, there is a lot of stigma, and I don't think that there should be. I think there are a vast number of Americans who don't realize quite how close they may be to experiencing homelessness and how similar people experiencing homelessness are to them in terms of having employment, wanting the best for their families, doing their very best to survive, right? And so I think that's just something that I want to kind of put out there, is that as folks think about solutions, right? Like, remember, these are our neighbors. They are everyday people, just like you and me and everyone on this panel who's speaking and listening, and that, you know, we need to keep in mind people's choice, people's needs, and the ways in which we kind of shape systems and structures to meet them, right? When we're thinking about actual solutions, there are a couple of things that I really wanted to touch upon in a little more detail, right? And I think the first thing is that we really need to think about addressing root causes and looking at our affordable housing crisis and what we can do to address that. Dr. Kushel mentioned, well, she touched on it a little bit, right? That there is a really big piece of legislation that is moving at, well, a slower pace than I'd like, if I'm being completely honest. And it does have a lot of really great historic investment in affordable housing infrastructure. And I'm going to put out there, if she did not convince you to call your member of Congress, I am going to say it again. Call your member of Congress at the end of the day, call them tonight, call them tomorrow, tell them that housing investments need to stay in this bill, right? I mean, this bill has about $90 billion to expand rental assistance to 1 million more households. It's got $80 billion for public housing infrastructure, $37 billion for the Housing Trust Fund to really invest in delivering housing to the lowest income people. And I think that that's an area that, you know, our country has been, I don't want to say struggling with, because I think that trivializes it, but has been neglectful of, right? Like, we as a country have not cared about people suffering the way that we should, and we need to do better. And this is, I think, the first down payment towards doing better. So if you're able and interested, and I certainly hope you are, call and tell your member of Congress, even if you're not in California, tell them we need investments in housing in this reconciliation bill. I think the second thing I want to touch on are supportive services. And I think the veteran population specifically is unique because the bulk of our homeless response really comes from a healthcare system, which is unusual, right? The nation's largest healthcare system is really investing heavily in addressing homelessness, looking at the root causes of the crisis and thinking about how we can, you know, do better at solving for homelessness. And I don't think that civilians are able to benefit from that directly in the way that veterans are. And so I think thinking about ways that you can add more supportive services, enhance what we've got there for veterans, and thinking about how even you can learn and adapt techniques that, you know, we've been kind of dabbling in and trying out on veterans is something that is going to be important to really address this crisis. I do think that upstream prevention and looking at how other systems interact with the homeless system to really keep people from becoming homeless is going to be something that's really critical. And that can look a lot of different ways, whether it's, you know, continuing financial support for people who just need a little bit of help paying the bills, or whether it's healthcare systems looking at how they're actually discharging people who are experiencing homelessness to the street or into housing, or, you know, unique collaborations that really can make all the difference for people who could be experiencing homelessness but shouldn't be, right? And I think the last thing that I'll touch on that is kind of, or well, that I guess we're grappling with in the veteran population is really targeting solutions to the needs of overrepresented or highly vulnerable populations. And I think when you look at the veteran population specifically, the groups that you see overrepresented are obviously Black Americans, Native Americans, transgender veterans. But then there are some populations that have differing needs that are growing at a pretty quick pace. So thinking about the needs of women veterans when you're in a system that's really built for single unaccompanied males, or thinking about the needs of aging veterans when, you know, you may not have the services or supports needed to address, you know, memory care or other things within the homeless population. So I do think that we've really got to look at our data and who is experiencing homelessness and kind of the gaps that people are facing to come up with creative solutions. So I think I will stop there, if that's okay.
Thank you so much, Catherine. I think you've stimulated a conversation, and there's actually been some questions as well during your talk. Let's go to Dana White. Dana is Program Officer for True Colors United, and we are putting in chat more about Dana and more about True Colors United. You're on, Dana.
Awesome. Thank you so much. It's really my pleasure to be here joining you all from Washington, D.C., where it's surprisingly warm today. But thank you for having me. Let's begin with acknowledging the obvious, right? That housing is a fundamental human need. We know it to be a determinant of health, of wellness, of survival overall. And if we can agree there, then it's not really a leap to acknowledge housing as a human right. And with that acknowledgement, with the belief that housing is a human right, our collective work really becomes a moral imperative. Addressing homelessness becomes a moral imperative, but also really a principled critique and a challenge to a capitalist system that has classified housing as a good, right? As something that has to be earned. So at True Colors United, we understand this fight to be a human rights fight. We understand homelessness to be a racial justice issue, a gender justice issue, an equality issue, and an economic justice issue. And we center and work with young people who have lived experience of homelessness, LGBTQ young people primarily. And so what are the numbers there among LGBTQ youth? According to a 2017 study out of the University of Chicago, we saw that LGBTQ young people are 120% more likely to experience homelessness than their heterosexual and cisgender counterparts. And we've seen this higher risk among queer and trans youth reflected in our own research at True Colors United, where it was estimated that about 7% of youth in this country identify as LGBTQ, but they make up around 40% of youth experiencing homelessness annually in this country. And what we know about how or why homelessness impacts LGBTQ young people specifically is that the causes are really much more nuanced than family rejection, even though family rejection is far too common. The causes of youth homelessness disproportionately among LGBTQ young people are aging out of the foster care system with little or no support, exclusionary discipline in our public schools and the school to prison pipeline. We know that this disproportionately impacts queer, trans, Black, Indigenous, and POC students. And we know that young people holding one or more of these marginalized identities are systematically pushed out of public education in this country, and that there are links there to housing instability and homelessness. We know that over-policing of Black communities, of Black trans women, of Black queer people, feeds mass incarceration. And we know that a history of incarceration has also been linked to housing instability and homelessness. And so this is a complicated issue, really. It's complicated by sexuality and gender bias. It's complicated by racial bias. It's complicated by policing. And it's complicated by institutional bias, specifically in our schools. And so how do we push our fight forward, the fight to end homelessness? We trust in people with lived experience. We trust that people know what they need more often than these organizations and institutions and systems really give them credit for or opportunity to name for themselves. And we know that this is true for young people who have lived experience of homelessness as well. There's really been untapped leadership and self-advocacy among young people experiencing homelessness. There's been a lack of opportunities for these young people to sit at tables where decisions are being made and to really be involved in the decision-making process. And so we have to take representation beyond tokenizing. We take it to the pen, to the paper, to the policy, to funding allocation, to program evaluation. And we know that when you meaningfully involve young people who have experienced homelessness, you empower them. You also innovate your programs and services. You challenge white saviorism. You redistribute power and resources. And you begin to work in a way that all of us should have been doing this work from the beginning, and that is to work ourselves out of our jobs, right? We know that ending homelessness is realistic. It is achievable. We know that all the resources exist in this country today to do it. And I think that we can, for young people, for queer and trans people, really for all people. So I'm really looking forward to today's discussion.
Thank you. Thank you so much, Dana. Also for bringing in new perspectives and to also to continue to to talk about the incarceration piece that sometimes does not get talked about. And I'm looking forward to what Michelle has to say. So Michelle Dodi Cabrera is the executive director of the County Behavioral Health Directors Association of California. And before you go on, Michelle, I just want to, speakers so far have been on time, which will give us a more fulsome discussion, and we'll go to what the questions are in Q&A and encourage the audience to post on Q&A, but also within speakers to promote intersectionality. I think what Mayor Schaaf was saying, let's not have tweezerism kind of looking at policies, that each of the panelists also think about, some questions or that you may have, or ideas for each of your co-panelists. All right, Michelle.
Thank you so much for the invitation to be a part of this panel. And I, like Catherine, just wanted to say ditto to everything that Dr. Kushel said, as well as to pile on both Catherine and Dana's comments. Really excellent start to this conversation. I have the honor of representing our county behavioral health directors who operate the Behavioral Health Safety Net in California, which is responsible for the delivery of specialty mental health and substance use disorder services in California. They do this within and beyond insurance reimbursement for individuals. It's a biopsychosocial model of care, primarily for those covered under Medicaid, but also for individuals with no insurance, as well as those who are underinsured with commercial insurance. And as Dr. Kushel alluded to, or very clearly laid out, for far too long, our housed public tends to look at those who experience homelessness and make some pretty massive assumptions about their condition, as well as their backstory. Oftentimes, individuals with serious mental illness and substance use disorders are among the most visible of this population and most vulnerable. But they've become both the poster children for homelessness and the safety net that supports them, a really convenient scapegoat for the broader drivers of homelessness, which, as we know, are access to affordable housing for very low income individuals. With that said, people with serious and persistent mental illness are absolutely overrepresented in this population, and again, are super vulnerable within it. According to HUD data, we know that approximately a quarter of the individuals experiencing homelessness in California are seriously mentally ill. And that compares with an overall rate of serious and persistent mental illness in the general population of around 4%. In addition, around 17% have a substance use disorder. And of course, a lot of this depends on how you frame the question. When researchers look at sort of broader experiences of mental health conditions or substance use, of those proportions could go up. And we know that the experience of homelessness, of course, is traumatic enough, particularly unsheltered homelessness, that it can trigger or even contribute to worsened behavioral health conditions, whether it's through the trauma of being homeless, not having family connections or stable housing, and also the stress that comes along with lack of safety or ability to provide for one's basic needs. It can really erode whatever coping mechanisms people have and bring them to the breaking point. So we know that mental health and substance use disorder treatment alone are not going to end our homeless crisis in California, because housing is the cure for homelessness. But in many respects, access to that housing is really challenged for people with behavioral health conditions. And we need a variety of different housing options for this population in order to help keep them safe. in community. One of the, and again, housing people with behavioral health conditions is medicine, it is healing for this population. But we're talking today in part about sort of this intersection between health and homelessness. And we know that, you know, a lot of the way that health care is structured in the US as an insurance-based model really doesn't work well to support people with behavioral health conditions more broadly. Certainly with housing, there are many, many limitations within the public insurance system, as housing itself is generally not a benefit covered under Medicaid. But there are other things that I think it's important to note that are crucial to both behavioral health clients and also their experience of homelessness that are not covered traditionally under Medicaid. This includes crucial outreach and engagement activities, those efforts that are about building trust and rapport with individuals who are experiencing homelessness and trying to get them into services on a voluntary basis. A common misperception about people experiencing homelessness is that they prefer to be homeless. In the experience of our frontline workers, that is not the case. The majority of folks, including those with behavioral health conditions, will take the housing and the services that are offered. In California, we've been lucky enough to have extra funding outside of SAMHSA grants or Medicaid in the form of the Mental Health Services Act, which has augmented funding for our county safety net and helps to support a lot of those services that fall outside of traditional insurance models, including a whatever it takes model. However, I will note that funding for substance use disorder services within Medicaid and outside has really not kept pace in general. And I think it's not well known that the substance use disorder benefits within Medicaid traditionally have been fairly limited. California was actually at the forefront nationally in expanding those benefits to include residential treatment services just 5 years ago under our last Medicaid waiver. And we're still in the process of sort of building out the system, but there hasn't been a lot of additional investment in that substance use disorder safety net. So I think that's really important when we're thinking about insurance models. And of course, the high needs that this population brings. I also wanted to note that, you know, when it comes to insurance, we have to also think about private insurance and the intersection there with homelessness and the safety net. I know I struggle to think of another life or death condition that is commonly treated like an elective procedure by insurers, both through the shortcomings of the insurance, but also with the fact that consumers who have access to resources or insurance, often when they don't get what they need within their system, they turn to a whole system of private pay providers out of desperation that, you know, to a large degree also falls short. And in the result, the end result is individuals who once had private commercial insurance end up disabled by virtue of their untreated behavioral health conditions and in the hands of the public safety net, which is frankly, you know, overwhelmed by the need that's out there. This also has an impact on employment and education. We know that the population of individuals with serious mental illness in particular has much, much lower employment rates when compared with the general population. And again, it's layered as a result of stigma, but also the disability that comes along with those conditions. And that can make achieving housing on your own outside of, you know, through employment really challenging. So I would say that our behavioral health clients are really a population that is far more vulnerable to fall into homelessness, far less likely to have the ability to, you know, overcome some of those elements to get into employment and have the ability to afford it on their own. So we really oftentimes are providing subsidies as well as supporting board and care, the full range of housing needs that our clients will need. And that includes in California, things like landlord outreach and recruitment, temporary shelter, and even permanent supportive housing, the full gamut. So, I think that it's important for us to understand, again, that there's a lot of promise in both the efforts that are underway right now in the housing sector in California, but also within insurance. And we need to look at these structural issues and understand where insurance is frankly going to fall short right now. But also, again, we can make advances, we can make improvements. We just need to look at it from this biopsychosocial lens that the public behavioral health safety net in California has already taken a lead on.
Thank you. Thanks so much, Michelle. So we've gotten some questions, and I think we'll just first thank you to all you panelists and to Marco Crucial for setting the frame. But let's go to some specifics, because I think this morning the audience hasn't really had as much interaction with the speakers, so I'm giving them access to you. So a question here, the first one is, have any efforts towards creating permanent, supportive, and affordable housing focused on programs to target food insecurity? So open up to the panelists.
I'm happy to chime in, and this is kind of a limited lens, right? Because very veteran specific, and I'll be honest with you and say that I'm not sure that I've seen any organizations who are currently creating affordable housing really looking at food insecurity. But what I have seen, right, are some organizations within NCHP's membership that already have affordable housing and permanent supportive housing, really looking at how they can partner with their community to use CARES dollars and innovate around meeting food insecurity needs among the residents within their building. So some of our members actually were able to partner with HelloFresh and other organizations to really get out there and distribute meals to elderly permanent supportive housing residents. We've got other folks who run food pantries and have absolutely seen a dramatic increase in need in their communities. So this isn't maybe as comprehensive of an answer as you'd like, but I mean, generally, right, housing instability and food insecurity kind of go hand in hand. And so I do think that that's something that we as a field probably need to be thinking a lot more about and being planful of as we think about creating affordable housing.
And for legislation, so does the reconciliation bill include any provisions for food insecurity?
That's a good question. And that's not my area of expertise. So I am not gonna go out on a limb and misspeak.
Yeah. Yeah. Michelle.
I'll just say under the Mental Health Services Act funded programs in California, whether it's the full service partnerships, which is a majority of the funding under MHSA, or No Place Like Home tenancy supports, we are able to, as I mentioned before, do whatever it takes. And that includes both providing funding for food as well as cooking support and other food access needs. So again, it's that stuff that sort of falls outside of insurance sometimes that becomes so crucial to really contributing to the overall well-being and stability and ability for folks to stay out. So today, that is a part of some of our MHSA-funded housing services and supports.
Thank you. I'm gonna, the questions are coming now. So there is a question from Colorado. And I know, Michelle, you talked about straining the public safety net. Eva's still on in Texas. A lot of it was all for private dollars, philanthropy. So the question from Colorado is, do you have any ideas for best practices of offering healthcare for people experiencing homelessness when your local FQHC is not willing or able to prioritize this population? And how do you engage local hospital systems to be more integrated into community, to offer more person-centered healthcare and truly practice this idea of health and housing? I'm gonna throw the ball to Margot to give that a try.
Yeah, thank you for that question. I mean, I think, as Michelle said, so many of the safety net healthcare providers are so overwhelmed. They were overwhelmed before the pandemic and perhaps even more overwhelmed now. I do think, as someone who's always practiced in a safety net setting, although an academically affiliated one and a relatively well-funded one, I think that we're always hoping that that our less safety net partners join us, that the entire burden can't fall on an overstrained system. What I hear often from the non-official safety net practices is that, they recognize this problem, right? They see it in their emergency departments. They see it in the challenges that they face discharging people. Sometimes they don't have the competence. This is not something that the healthcare field has done a fantastic job on. I want to, shout out to my colleague, Dr. Kelly Duran and colleagues just had a new book put out for emergency medicine providers, like it's basically a textbook on how to address social needs in the emergency department. And I do think it's something in the medical field we need to get our acts together on more to build up that competence, because it is a real competence like anything else. Just like managing the medications for diabetes, you also need to know how to address community resources and what are best practices. So I think that there is an interest there from the folks who might not have been at the table before to sort of find some common ground, because they, what I hear a lot from some of the larger healthcare chains is that they're kind of struggling, right? They don't know exactly what to do. They see people experiencing homelessness in the emergency department, they see them in the hospital, and I think their intentions are good, but they feel like this chasm between the homeless system and the housing system and the healthcare system. And so some of it, I think, is not going in with the mindset of it's sort of FQHC or bust, because I think the FQHCs just have so much on their plate right now, but perhaps, and I'm not saying this is easy, but extending a hand out to all the healthcare providers and seeing where there can be partnership and mutual aid, right? That everyone needs to show up at the table here. I'm not saying it's going to be easy, but I think a lot of it is competence. A lot of it is siloing, that people in the healthcare field don't really understand the homeless system and don't know the homeless providers, and then to recognize that there's actually a shared interest, that this is really a win-win. Obviously, for the people experiencing homelessness, we need to win by taking better care of them, but I think you could also make the case that it's a win-win for the health system.
Thank you. Our 11:15 question was, I'm always struck by the tone of these conversations. It's all about social services, charitable operations, without consideration of the importance of building the political power of unhoused people. In Seattle, there are self-help mutual aid operations that are governed by those who participate in them. Tent cities, tiny house villages. The participants collaborate to agitate politically, along with organizing their own housing projects. Any examples of this sort of work in California and elsewhere? And I'm going to ask Dana to, because that was one of your appeals, was, no tokenism, no saviorism, no, like nothing about us without us. So it's also related to the 1202 question, was what kinds of youth empowerment tools can we implement in policy to help our youth, LGBTQ, who are unhoused, and not only getting housing, but also to sustainably uplift them out of the early childhood trauma that they've likely experienced?
Awesome, I appreciate this question. I will say that in my experience working with True Colors, providing technical assistance nationwide under HUD's Youth Homelessness Demonstration Project, our focus is on developing youth action boards in each federally awarded community who really not just advise, but represent youth voice and youth with lived experience on Continuum of Care boards. They really are crucial to determining where funds will be allocated. But we have emphasized the importance in our work with youth action boards nationwide of them operating as individual entities and not as part of any particular organization or larger adult-run federally funded entity, so that they always have that opportunity, that room to agitate politically and to take on the causes locally that they feel passionate about, that are related and connected to the youth homelessness crisis. locally. I'm speaking for myself here and not necessarily for True Colors United when I say that I would really love to see similar bodies at all levels of government, young people with lived experience of homelessness, really informing policy at the local level, at the state level, and at the federal level even, like some sort of presidential advisory committee on youth homelessness, if you will, that hasn't really existed historically. I definitely think that this is a fight that we have to approach from multiple angles, right? The nonprofit sector has its role within the sort of restrictions of its funding, but we definitely should be looking to empower groups of people who have lived this experience to hold their elected officials accountable, to make the necessary noise in the streets as much as we're able.
Thank you. Panelists, any afterword on that?
I mean, just a huge cosign, nothing about us without us. And I think we see that probably not enough, but like just as an example, in San Francisco, in the big Proposition C, our big local funding effort to be similar to Measure H and HH in LA, very much guided by the advisory board, sort of deciding where the funding is going, with a large, if not majority, representation of people with lived expertise. Very strong groups like the Coalition for the Homeless in many places that really need to be at the table. And I think the really interesting thing with sort of tiny home villages is you see like lots of different models, some with truly outside sort of managing it, some that are completely homegrown, and some that are these sort of shared expertise. But yeah, just a really important question, and thank you for bringing it up.
Yes, thank you. I'm going to go to the 12, I think okay, so 11:15 is answered. I'll go to public education in a bit. Let's go to the 1203 question. This was addressed to Dana White, but I think this could, we could hear the thoughts from the other panelists. Are you concerned about the heightened activity of institutional investors in buying up residential housing to be landlords to generate, ROIs, return on investments, to their investors? And what do you think can be done to halt the current activities in the housing marketplace that monetize housing as a commodity and that increase the cost of housing at all levels? Also, stay tuned for tomorrow, because we'll also perhaps get some insights from the panel tomorrow on this question. Barbara.
Yeah, I definitely encourage my colleagues to jump in with any feedback here. But yeah, I think it goes back to my response to the previous question about how we need to really be building grassroots advocacy power and really political education around the issue of housing and where funding goes, and how all of these things really sort of operate behind the scenes in a way that most people who are housing insecure or homeless have really no awareness of, particularly young people. Like, this is information that is so sort of hidden to folks unless you have institutional involvement or government involvement yourself. So I would say public education, political education around how housing funds are dispersed or distributed or allocated at all levels, and really helping people build their advocacy power.
I think that's so true. Oh, sorry, go ahead, Michelle.
I was just going to add, I think that this issue of sort of what's happening in the market, it definitely has an impact on our safety net systems as well, that are looking to try to find and fight and source affordable housing for our clients. When we have access to the resources, is there something in the market that we can actually buy? We've been losing boarding care facilities at an alarming rate. And I think it's not well known the degree to which that here in the overall scheme of housing is so crucial to keeping people safely in community, safely housed. And, so often we're sort of between a rock and a hard place where, the ante gets upped in terms of how much these properties are worth, that it doesn't become worth it for the operators to hold on to the property and continue to provide this service at such a low rate when they could just sell the property and make a ton more money. And so, I do think that we could do more to establish guardrails or work to support finding, the various tiers or levels of housing services and capacity that are needed in community. Of course, in California, we in some regions of the state, like San Francisco, where Margot's at, there just isn't a lot of land, right? And so all of these things come into play, and it's going to take, again, a lot more effort on our part to both hold on to what we have and build out that new capacity. And I'll just say one more thing, which is that with the population of individuals who the county behavioral health safety net are serving, because of the criminalization of people with behavioral health conditions, it becomes even more difficult to find suitable housing options when you have people who are, not a felon in my backyard, not a person with an arson conviction, et cetera. I mean, I think it's important for people to understand how the deck is stacked against us, and certainly what's happening in the market impacts our ability to use the resources that folks are moving in our direction.
Thank you. I think this is related to your presentation, Michelle, but I also want to pivot to Catherine, because the VA is a example, well, at least in healthcare, is a model example of an integrated system. So there are questions from our attendees who are looking for health systems that have a good model in partnering with local agencies or supporting housing services.
So I think VA is probably the model you need, right? And I do think that the way that they've kind of created a mix of both in-house VA clinician provided services and also services that they fund out in the community with grantees. And, I do think that that's a good thing. I think the other thing that I want to point out is that having an integrated system like that is really beneficial to veterans, because when any veteran goes in to see a clinician, right, they do have all the screener questions, and they literally ask you in the first 10 minutes of your appointment, do you have somewhere to sleep tonight, or have you experienced housing instability in the last 12 months, to try and get a handle on, okay, maybe this is someone who we need to keep an eye on or refer for other services as needed. And I don't think, I'm a civilian, I'm not a veteran, and never in my life has any of my medical clinicians ever asked me hey, are you doing okay outside of your whatever the condition is you're here to see me for? And so I do think that there are some really unique benefits there. I will say that the one other thing that is really great when you look at the VA system, right, is that because it's such a closed system, you can actually take a look at utilization, right? So healthcare utilization of folks connected with housing versus before they were in housing, or different things like that you don't necessarily have access to in the civilian system. So I do think that if you're looking for a model, the VA one is not perfect, but it's probably one of the best that you'll find in this country.
Catherine, can I ask you, you talked about that you represent the needs of the VA population, particularly marginalized communities, and particularly since it's not really population representative on who serves. But how hard is it of a lift to convince decision makers to focus resources on specific communities?
Well, when you say specific communities,
like LGBTQ
geographic?
communities.
Oh.
No, I'm talking about, LGBT communities, for example.
So I think
How hard is that to
the
get?
one thing that's nice about veterans, right, is that there is always that argument that they served in the military and they earned their right to access to whatever the service might be that you're pushing for. That said, it's not always easy, right? I mean, certainly it's not as uphill a battle as it may be in the civilian population because there's a little bit less stigma, right? Where you're not like, oh, well, those folks who are out there using all of the things and being bad people and going in and out of jail, right? Like people don't necessarily attach that level of stigma to veterans because there is that other part of their identity, right? Where you're like, oh, okay, they either were drafted or they volunteered to do something for this country, but it still can be challenging. And I mean, I'll be honest with you, I think one of the nice things about VA is that it's a closed system, but if you've seen one VA medical center, you've literally seen one. They're all different. There are some that have really robust services for LGBTQ veterans and others where services are just not really there to the level that they need to be. And it's, I think, always an uphill battle.
Thank you, and maybe not thank you, but good to hear that. Or that you're so open in telling us this. I want to go to there's public. I'm going to go back to the public education suggestion, more of a comment. But if we're looking at prevention of homelessness, don't we? This is the 1150 question. Don't we need also to focus on the need for quality public education? I mean, Catherine, you use the word upstream, which is a very public health term, you know, looking at upstream determinants. If we fail to prepare young people to succeed in the job market, then they'll be more vulnerable to failing to secure jobs that provide for a livable wage and place them at higher risk of becoming homeless. So homeless advocates have more than enough challenge to face. Is there any activity looking forward to the impacts of mechanization, automation that may lead to significant losses of jobs, new sources of homelessness? So again, a future scenario of more risk for job loss. Margot.
I mean, I think it's important to connect these issues, right? Like our public education system is tied to local economy. So you have like Palo Alto or Piedmont, California, which is like literally carved out of the city of Oakland, which have these enormous tax bases, and their public schools look like sort of fancy private schools, right? And then you go right next door to the formerly redlined area of I'm so Northern California focused, but I'm sure everyone can do the math in their own community, like, you know, East Palo Alto or the rest of Oakland, where the public school systems are so disinvested. There are fantastic people working in those systems, and of course they are brilliant and fantastic and full of energy, you know, and everything, students, but like we have to acknowledge that this is the world we built, right? These systems, like the redlined areas, we still live in those redlined areas, and that that you've got one district where it's like the school to prison pipeline, where, by the way, it's pretty hard to concentrate in school if you are hungry, if you are homeless, you know, and then you've got other schools right next door that have these like lush campuses with swimming pools and like, you know, small class ratios, and frankly, teachers whose students maybe don't have as many structural barriers that face them. So it's sort of easier to teach it. So I think we really need to stop talking about this as like, if I have one more discussion where it's like conservatorship is the answer here, you know, I mean, like, you know, we need to recognize that we're really, yes, there's a lot of ableism that contributes to why people with behavioral health disabilities and the way that we criminalize those behaviors just do it. And particularly those behaviors in people of color, by the way, or like with mental health or substance use disabilities, as opposed to white folks who have those disabilities who are treated quite differently. But these are all connected issues. And then I think, you know, my dear colleague Tamika Moss was talking about like, you know, housing affordability is both the cost of the housing and the income level. So of course we need to be talking about economic development and good jobs and all of those things. These things all go together, but I feel like we're like looking where the lamppost is. We're having all these discussions about one thing where we're actually ignoring the big problems ahead of us. I don't know if that's more depressing or less depressing, but yes, they're all connected.
No, I also appreciate all the audience putting their comments because and suggestions, because this will be memorialized in this policy, you know, paper that we will develop as a result of the conversations that we're having in this symposium. So I'm just gonna go linearly now to make sure I catch up everybody. 1118, what about focus on healing families of the homeless in California, many families I've worked with over the years, home healthcare professionals are like mine, pitching in to feed and house mentally ill family members at great financial and emotional expense. So for many homeless people, I imagine this option either did not exist or the family system cracked under pressure and they ended up on the streets. Michelle and then Margot. And Dana and
Yeah,
Catherine.
I mean, again, I think this again speaks to sort of that push-pull, right? I think rather than looking at this as sort of what did the person with mental illness and their families, how do we support them better? And we need to go more macro level, right, to make sure that there one is enough affordable housing for people of all income levels, understanding again the ways that bias and discrimination play out, the way that people with serious mental illness and substance use disorders are allowed to become disabled by virtue of their conditions. We need to know that the result of that is going to be people not being able to continue in their education or not being able to find employment in ways that are sustainable. And so, it does shift that burden onto the family and the individual and make them so much more vulnerable to not being able to earn enough money to get the rent together. And so, I think it's really important for us to, again, say, could we do more to support those families and individuals? Absolutely. But when we have enough housing options, when we have enough, people are okay, right? And so the question for us becomes, how do we manage to bring more affordable housing options in while, yes, we are working to break down those systemic barriers of stigma and discrimination of all kinds that play out in this population. So, I do think it's the support for the family is crucial. It's necessary, but only because of some of those other structural issues that are at play.
Go ahead, Margot.
I would just love to see us take 100% of that, like a strengths-based approach here. I think there are these sort of white savior organizations of like, if we just connected the homeless person to their family, like all would be good without, which is sort of like really like without acknowledging one thing for family members of people with behavioral health disabilities, how can we support them, right, to support their loved ones? And then, what we've seen in our research in Oakland, which is a predominantly Black African-American homeless population, overrepresented by a factor of 4, those folks were deeply connected to their families, to their churches. Those families and churches and communities, love them, care for them, but we're facing enormous uphill battles. So that, like what we heard when we interviewed both the people who are homeless and their family members, is that their family members were like looking over their shoulder for that they were about to be evicted, that their landlords were looking for reasons to evict them. If you own your house, you can bring in any family member you want. If you rent your house, it can be a lease violation. So in these gentrifying neighborhoods, these families were like, if I bring, and so we heard from the homeless folks, if I go in, my niece wants me to come in, but if she gets evicted, then my grandniece is out in the street. I'm not going to force her to be evicted. I want to call out a few practices we have. We will spend a lot of money on shelters, but God forbid we gave families, $1,000 a month to help them offset the cost of having an additional household member. We just don't think that way, right? We don't do that. And these families are often living on the economic margins. We don't help with things like legal help to get someone put on the lease or other ways to make sure that they don't get evicted. And then a third thing I want to call out is that if you're living in a shelter, you are homeless, and your prioritization for any resources that come is not impacted. If you move in with your family member for 6 months, the system no longer sees you as homeless. And so you go way down on the prioritization list. And we heard from people again and again, I would much rather be with my son than in the shelter. But over the rest of my life, I can't live with my son forever. And I recognize that if I move in with my son, I fall off any priority list. We need to fix those policies that really disadvantage the families.
No, here. And actually, census statistics show that multi-generational households, high density households are mostly lived by communities of color. So Dana, you were nodding your head. anything, would you like to add, particularly from a perspective of LGBTQ and youth? Like how do, a lot of what we've been talking about has been kind of some handle to I do a job or, so what about youth?
Absolutely. I really appreciate the point being raised of, the difference between, in this case, let's say a young LGBTQ person staying in a shelter versus couch surfing with a friend, an aunt, a cousin, and the prioritization that happens there, the differing prioritization, and how that really changes their ability to access, let's say, transitional housing or a voucher. That really is what complicates a lot of the cases I've seen when it comes to young people who, maybe they could stay with a friend for a week or two, but it is better for them if they want to get housed more permanently to go to a shelter, but then the shelter is not necessarily affirming of, let's say, gender identity. So it's really trapping young people between this like rock and this hard place. And there's really a need for us to shift the way we assess need, particularly for young people, or assess risk, or how we prioritize who gets housed. And it really goes back to shifting our lens to like, listen, everyone who is unsafely or unstably housed, the top priority is housing them first and figuring out whatever else we need to figure out from that point on.
Thank you. Certainly, in crafting public policies and implementing programs, it's the measurement, the assessment of how need is. So I'm going to have the panelists start thinking about what they're going to ask the other panelists. And, what struck me so far in these proceedings has been that there's there's a call to work together. And there's different, jurisdictions. There's Eva talked about Love HUD, because that was the only really financing for Houston for her, as well as philanthropy. We heard about cities, versus counties, like the mayor talking about, she was about cities, and really health and mental health was about counties, Michelle. So then thinking that how and the affordable housing folks, and then the supportive services folks, how do we attempt to put this all together? And how do we attempt, at least from this panel here, how a takeaway from both your perspective, but also from the perspective that you've heard from your co-panelists, that is a glimmering light on, how we can solve some of these problems together. So I'm gonna go with Catherine first.
I don't know that I'm ready. I do think that there is value in thinking about how we provide resources to folks who don't have them yet, or for whom the programs we have aren't really working out for, right? And I feel like that's a kind of a theme that I picked up on in all of our presentations, really, right? Is thinking about how we make what we've got, or new solutions, work better for people who are not well served by what is out there right now. And so I do think that that's kind of ruminating in my mind now, and thinking, well, I guess I'm just kind of thinking about that a little more. So I don't know that it's so much of a question per se, but.
Yeah, we can come back. I mean, because with the VA being one model, then we could learn from the VA. And also in terms of education, just wanted, I have colleagues here that are showing me notes. Also the community college system, again, would also be another important point of public education and access to resources. I know we also didn't get to all the questions. Some of them were suggestions that will be memorialized. Some of them were questions that in terms of resources on mental health. Michelle, perhaps we can put a link on some resources for people who are experiencing mental distress. But who's ready for some takeaways? I don't want to, Michelle.
You know, I think that there are obviously, you know, the safety net for behavioral health in California has been doing this work for a long time. And I think that for a long time, the community writ large saw fit to see it as sort of a problem that was unique to people with behavioral health conditions and get your act together, safety net, why aren't you doing better? And I think we're at a moment over the last couple of years where we've really started to shift the discussion in California to understand some of these more macro drivers of homelessness, and the fact that people with behavioral health conditions are, you know, unfortunately, the canaries in the coal mine, some of the more vulnerable folks who are apt to fall into homelessness and then have a much harder time of getting out because of those same systemic barriers that sort of led them to that place in the first place. So our plea, I think, is just a few things. One is to really prioritize the most vulnerable within the homeless population for resources. I realize everybody who's experiencing homelessness is vulnerable by definition, and I think that there's a little bit of sort of a prevention strategy, early intervention strategy, but I think as we're moving to sort of understanding the big picture more, we cannot forget about those folks with the most deep and acute needs, and really be more flexible in trying to prescribe what is necessary, because at the end of the day, as Dr. Kushel said, housing is a part of healing for a lot of people. It's a part of their ability just to be well in community. And so certainly the safety net systems that support them need access quickly to a wide range of options, both to prevent and support people. And then I would ask policymakers, you know, we talked about education as upstream, but I would really ask policymakers in California to figure out how we can hold private commercial insurers accountable for doing better, doing more at early signs of psychosis in young people, because we certainly do not need more folks to unnecessarily become disabled by virtue of their behavioral health conditions. We need much, much more robust benefits across both public and private insurance, and also funding for those services beyond healthcare, because again, it won't just be healthcare that solves these issues. So really appreciate the discussion today and the perspectives here.
Thank you. Unfortunately, we are out of time. I'm going to ask Dana and Margot to put their, like, what's their ask or in chat. If you could, apologies for not getting to you. I thought we had plenty of time, but we're now over time. And I wanted to thank each and every one of you for joining us today, for all the work that you do, as well as conveying that to this group of, I'm sure, already policymakers, activists, but some of us are learners in trying to understand the depth of the problem. So, but not just thinking about what the problem is, but coming up with as the way forward, as actually one of the chats had said. Thank you all. We're going to move to our closing session, and don't go far, because I'm sure we're going to pick your brain at some point in the course of the next 2 days. Thank you. So our next speaker, so today's closing speaker, keynote speaker, is an illuminating voice in this conversation, whose leadership is inspiring and whose honesty and lived experience is exactly what we need right now as we look to create change here in California and beyond. As a Skid Row resident, Suzette Schaaf has been using her voice to advocate for others experiencing homelessness. She's a poet, she's an activist. I heard today the word agitator, so an agitator who writes, talks, and advocates Skid Row from a woman's perspective. It is my honor to welcome Suzette Schaaf.
Thank you so much, Ms. Ponce. I'm so honored to be in space with you all today. I have so much to say in such very little time, I understand. So let me get started. Okay, so I was displaced to Skid Row. I was displaced into homelessness 9 years ago, almost 9 years now living in Skid Row. And with that said, you know, I was living in a middle-class life, a struggling middle-class life as a single woman, yet still a middle-class life. I was living in $1 million neighborhood. I was second in charge of my Manhattan-based company in my hometown of Yuma, Arizona, of a business processing plant. I was working with a loan officer to buy a home at the time I lost my job, April 23rd, 2010. I'm a former certified caseworker through the state of Arizona TANF welfare program. Basically, in a nutshell, I ran my own programs. And then at the age of 47, I ended up on public assistance for the first time in my life. I know we had some folks on from the Bay Area. I lived in Northern California for almost 20 years. Oakland was my last residence. I worked for Oakland School District as a hiring manager. I hired for approximately 60 plus schools. I didn't know then to know that when I was having to go from different places and moving and couldn't afford to live in, you know, this community and got, you know, evicted from this community, what have, I didn't know to understand then that there was a term called homelessness, because I'd never heard that term ever in my life. My mother implemented the food stamp program in my hometown as well as throughout the state of Arizona. And she brought legal aid to my hometown as well as throughout the state of Arizona. Yet I had no idea of how to put myself on social services when I ended up on social services at 47 years of age. Now, one should ask, how does someone like a Suzette Schaaf end up on public social services for the first time at 47 years of age, and then just 2-3 years later end up in a community called Skid Row because she had no other place to go? And let me just give you a little backdrop in regards to Skid Row. So Skid Row is here in Los Angeles, California. It's literally the hidden shame behind the Hollywood glitz and glam. So here in Los Angeles County alone, Black folks make up roughly 8 to 9% of the overall population. But depending on which time you're hearing the statistics, we're the prevailing population of poverty and homelessness of 35 to roughly 45% at any given time. Here in Skid Row, I'm a poet, and my poetry, I oftentimes say Skid Row looks like the slave motherships capsized right here in our concrete jungle. Skid Row is has an overwhelming population of Black folks. Again, roughly 40%. I don't have my statistics in front of me, but Black middle-aged elderly women, we track as a #1 demographic displaced into poverty and homelessness. And this is not just year after year, but it's literally decade after decade by huge disproportionate numbers. So once I ended up displaced into homelessness, I just became part of the broad stroke pathology of who a Black woman is, who has to come to a place called Skid Row because she had no other place to go. You know, we're just in the beginning month of October and acknowledging domestic violence. Many of us are trauma survivors, domestic violence. We're Black folks. Intergenerational trauma is already in our DNA. As Dr. Bessel van der Kolk talks about, the body keeps the score, right? So we've got trauma going all the way back to slavery, Reconstruction. We talked about earlier the systemic barriers. We've got impoverished networks of trauma going all the way back to redlining, urbanization, Jim Crow. And that continues to perpetuate the harm of what exists today in a community called Skid Row. As we here in this community today are dealing with the systemic barriers of zoning laws and ordinances. We're in the midst of LA 2040. how do we propose what Skid Row is to look like between now and 2040? In the midst of gentrification and urbanization, right in the midst of our city leaders allowing for, you know, gentrification to come right here in the midst and the heart of Skid Row, right as we know people are displaced into poverty and homelessness and living in, according to United Nations refugee camps, people are living in less than third world living conditions. This is part of the cognitive dissonance, as the mayor so eloquently, she kind of touched upon, and I give her great due respect as far as acknowledging through her humility, her cognitive dissonance of when not really wanting to take the ownership of what was going on in Oakland back in the day. And then at some point, she had to acknowledge that she, as well as all of us, play a part and defining and having to be the voice for change. And when you're an elected official, your hand is on the pen. Your hand is on the pen. You literally have the ability to shift the narrative and to shift what the systemic barriers that are written into the laws and the ordinances that go all the way back to the redlining that still exists within a lot of ordinances and laws within each and every city and county across our nation. And if you're familiar with a Ta-Nehisi Coates and a Richard Rothstein, then you know what I'm talking about here. The fact of today, housing developers working in conjunction with our government officials are being given tax credits and being allowed to pay a linkage fee that continues to exempt them from really having to take acknowledge and take ownership and accountability that they continue to perpetuate the same doggone harm that even goes all the way back to redlining. Of how, you know, you can pay a fee and that fee gets your way out of really having to create housing for those who are living out here on the streets. So we continue to perpetuate these systemic barriers. We talked earlier in regard to the fact of a government here in California owns 50% of the real estate. 50% of the real estate. Imagine that today. That's just today we're talking about. So imagine if we go back, you know, all the years and decades and generations prior to that would allow for this continued perpetuation of how we have not talking about a person. We're talking about families. We're talking about communities. We're talking about whole populations because we don't live monolithic, any of us. So, so then we have families in communities that have continually back and forth with no real strong foundation and infrastructure that allows them to not only survive, yet thrive. So imagine if our government took that same pen and they reversed some of these redlining laws that they created through eminent domain here within every city and community across California and across this nation. Imagine if our federal government made housing developers accountable instead of giving them continued tax credits and tax breaks without holding them accountable for creating low-income, affordable housing for our most vulnerable populations, and reversing these red curl and urbanization laws that they have continually perpetuated. Imagine if zoning were allowed so that people could build housing so that it's a single family unit that multiple families could live upon and they can build upon. They could build up and not just out. They could build up and build out. Imagine, I'm not an expert on this, but what I am saying is that there are systemic barriers that our government has allowed has allowed to continue to perpetuate, all while shaming and blaming and throwing us out here to really kind of fend for ourselves. When we talk about race equity, we really have to call out, Dana and some others. I applaud you all for the voice of the lived experience at the table, and not just at the table as a token, as Dana highlighted, amplified, but really the voice for change, really shifting the paradigm, leading the conversation. Beto O'Rourke got it right when he came to Skid Row and met with us ladies here in Skid Row. And then afterwards, I found out days later that, someone asked him about myself, and he said, imagine a Suzette Shaw or someone like her who was leading policies in this nation, someone with a lived experience and the compassion. We would have a much better outcome than what we have today. Imagine that. Imagine that. Why is it that the Governor Newsom has no person with lived experience on this advisory board for the state of California? So all when we're talking about shifting the paradigm and making and calling out the systemic barriers, what I have to acknowledge and notice, we've had all white folks talking this morning in regards to the issue that we got Black folks, Black and brown, mainly Black folks living out here on the streets. This is the problem. These are the systemic barriers. This is the cognitive dissonance. This what has to be changed. You can't speak for me. You have not walked in my shoes. You do not understand that this is not just about me. This is about my mama. This is about my mama's mama. This is about my family. The fact that, someone earlier talked about, I think it was a man by the name of Ting, called out, our farm workers and how our farm workers, well, you know what? Black folks are the original farm workers. We are the original farm workers. How about that? My family migrated to Yuma, Arizona in the 50s from Arkansas. And they moved and they were allowed to live where Black folks were allowed to live then on the compress. And where they were allowed to live is where they also picked cotton before they were then allowed to move into town. And when they were allowed to move into town, they went from picking cotton to cleaning white folks' homes. And then my mama became was a cook in a Mexican restaurant back in the day when Black folks still had to come through the back door of a Mexican establishment. Imagine that. So imagine today, if I talk about the fact that my mama had a city administrator for the town of Somerton, changed the chartership from the town to a city. Was executive director for Native Americans for social services programs, on and on and on and on and on, and bragged about her memory that she knew just from sight, and yet sued HUD when my twin sister and I were in 6th grade for racial and sexual discrimination. She sued the city of Yuma and HUD for discrimination. And it didn't go before a court until we were in college at Arizona State University. And imagine this, the judge said, I believe you, but the statute of limitations has run its course. Do you know that my mama could not get, she was blackballed, she could not get sustainable work. Do you know that, do you understand that the life that continues to suffocate a person continues to suffocate, and then that ends up suffocating the rest of the family. When I moved back to Yuma, Arizona in 2003, 2004, people said, don't tell people who your mama is. That's what people told me. Don't tell people who your mama is. So imagine when I'm now living back in my home, the home that I grew up in, and she has to look at me. I'm a mini me of her. And I'm a constant reflection of what she isn't or wasn't or did not get to do. The last job that she held was picking clothes at a Goodwill, picking out clothes at a Goodwill, and she got fired from that job. Picking clothes at a Goodwill. This is a woman who was running programs at the height of, so again, we're the last one hired, we're the first one fired. We got the, pathology of the depth psychology of the angry Black woman because you don't understand our trauma. You don't understand my trauma right now. So many of you, oh, she's loud. Oh, she scares me. Oh, she threatens me, because there are the systemic barriers and the scars that we carry internally that continue to perpetuate the harm against us. That the trauma is not just about somebody striking a chord at me. The trauma is also about the system that continues to perpetuate the harm done against me and to us. How we can live in communities and historically be part of the community and as far as creating the community, and yet even here in Los Angeles, a Biddy Mason is historically our ancestors from Bronzeville, yet our history never gets to give us the due diligence and ability to have land set aside historically that should be ours rightfully, but it happens for everyone else. So you would think here in Skid Row that when they're talking about a 2040, that we would say, well, hell no, because you know what? Black folks historically created downtown Los Angeles, a Biddy Mason, a Bronzeville. So white folks should have no opportunity whatsoever to come into Skid Row and continually to perpetuate the rezoning and continually reducing the size of what a community called Skid Row is. But you know what? If you were to go to Yuma, Arizona, just like probably many areas and across this nation today, you're not gonna know the history of my mama, my grandparents, and the small Black community that moved there in the 50s to build a Yuma, Arizona, and contributed to it, because they never put us in the history. They never made us part of the history. And if you don't have to acknowledge us in the history, then you don't have to give us the equality and the land and the opportunity to not just survive, but thrive in the communities that we have not only just helped build, but to sustain and to thrive in. That is the critical theory of why white folks today do not want Black folks written into the history and don't want real history really taught in our schools. I'm going to end with this, if you don't mind, Ms. Ponce. I'm not a liberated woman. I'm just a woman who yearns to live free. And I wish to live free from the bondage of inequality. I'm just longing for equality that is yet to be. Yeah, we've come far, but how far we have yet to come. Women are still striving for their equal sum. And whether we're sitting in the White House, Donald Trump Plaza, or up in Beverly Hills, to the lows of the Appalachians, the rundown sawmills, or the Catskills, whether your zip code is in Manhattan, New York, or right here in Skid Row. Human dignity should not come at the price, for only those can afford concierge prices and exquisite means. And I humbly tell you, my voice, it is my power. It fuels me each day. In fact, it gives me the strength which surpasses none. It allows me to be more of my equal sum. Please know I'm just one voice, and I've won no battles. The battles have yet to be won. This voice is just another gift God gave to me so I can stand tall for dignity and equality. Thank you. I wish I had more time.
You're coming back tomorrow, though, right? You're coming back tomorrow. Thank you so much. As I was texting, I'm transfixed. I didn't want you to stop. Thank you for making us think about imagining. And this is the room for us to imagine, reimagine, implement, transform, and what you have done is both transfix and transform. Thank you so much. Those were powerful. You're getting a lot of comments on your presence and for calling out. As you said to me, you're known as sort of the BS meter. So thank you. And I just want to share with everyone here that, you know, Suzette got the announcement about our symposium, and she emailed us and said, why am I not in the symposium? And it's like, yes, it's because we build programs based on our perch of networks. And so it's just same old sometimes, but we really did try to have many voices in the room. But as we know, we need to work harder. I thank you, Suzette, for sharing your experience and really looking forward to you joining us tomorrow. And tomorrow, 9:30 in the morning Pacific times when we're starting. Our featured speaker is Donald Whitehead, Executive Director of National Coalition for the Homeless. And we heard a lot about the county and also what some policies such as education. I didn't hear minimum wage, but definitely that's part of the macro policies. So there's going to be a panel tomorrow that will talk mostly about LA, Suzette. So the housing for health in LA, so it's whole person care. And then we will get more, hopefully both an ear and a voice of imagination from Assembly Member Isaac Bryan, who's our Assembly member here at UCLA, product of UCLA, has lived experience and is going to be here to both inspire us, but also to listen to us. So thank you, Suzette. And then we'll have some reflections, but for those of you who are students out there, do register for a student session. It's a discussion and networking. We're actually also going to bring Suzette in with a really, no holds barred poem on kind of this whole otherness, being a student and saying, oh, this is an internship. So do join us. And I'm going to close today and with a big thank you to all of you and to all of the participants and to all the people and talent and love of many folks here in the room in developing this program. So looking forward to seeing you tomorrow. And Suzette, thank you.